and maximize and sustain as what you see here. So I just want you to remember that today is all about lifting up the CHW workforce, maximizing the utility of their roles and skills, as well as sustaining this workforce throughout Michigan and nationally, essentially. So if you ever wonder what this means, here is what our annual meeting theme is all about: everything CHW. So now another opportunity to poll. Please tell me how long you've been dedicated to the CHW workforce. If you'd like to respond here, just go ahead and I'll see the slides change and the data change as folks respond. Happy to have you participate with us. I'm actually going to interact myself. And again, this will be open for 60 seconds and we will continue to go from there. Richard McQuarrie is good at annotating. I see you connecting with us. Wonderful. So it looks like we've got, based on the 32 responses so far, many of you are CHW newbies. So this is great. We'll have the opportunity to teach you some things, learn from each other, learn from some other states, and hopefully that helps you be more dedicated to the CHW workforce as we continue throughout the presentation and the day. So here's just a rough view of our agenda. Today we are going to I've already started virtually with the technology check-in. I'm going to continue with my updates. We will recognize our sponsors. We'll then have a keynote address that I am eager for you guys to hear from. Dr. Shreya Kangovi and Ashley Harris from Pennsylvania. We're going to give you a break. And if you need one, before we actually formally break, feel free to do so. Stand up, stretch, do those neck rolls that Portia shared. Ladies, please continue to manage the breakout session or the participants, please, in the waiting room. Thumbs up, Jen, thanks. All right, so we've got afternoon breakout sessions that most of you will participate, that will likely be an hour long and an opportunity for you to directly ask questions. We're going to acknowledge some of our special CHWs that we want to highlight this year. And then we're going to have our closing remarks from MiCHWA's 2021 President, Jay Clement from Henry Ford Health System. All right. So let's level set a little bit. I like to start all of my presentations off making sure folks know about MiCHWA, who we are, and what we do. So MiCHWA is an organization that is focused on maximizing and sustaining that CHW workforce in our entire state. Our vision from the board of directors is that Michigan will have access to a trained and sustained CHW workforce. So I am proud to share our mission with you and our vision, and hope that you see that in all of the interactions that we partake in today. So this is a little bit about our governance structure. This is important for folks to know. We are a small nonprofit. You can see that our team is only 5 folks, but we are mighty. We have a strong and dedicated board of directors that have been here since the beginning of MiCHWA, roughly 2011. And then we have these various working groups that are important to us and help us move the needle as it relates to that CHW workforce in the state. So if you want to know how we function and how we operate, our governance structure is the way to go. This is also on our website that we'll highlight a little bit later. So I want to make sure you guys are able to connect with us, learn more about us, and then also engage. We have many leadership opportunities. We have policy work groups, evaluation groups, communications, a large CHW network advisory group, and we are happy to engage with anyone else who is interested in joining a work group. If you're not, that's perfectly fine, no pressure from me. And if you want to be contacted later, please know that we will contact you. All of the data that you're sharing in Slido will be saved for our use later. So make sure you mean your yes when you click yes. Okay, so like I said, if you check the MiCHWA backgrounds behind me, all of our staff have the same logo in our virtual background. Wave, ladies. We are a small but mighty team, as I shared before. I'm Janae. I am your executive director. We've got Nicole, who is our administrative assistant. She's in glasses today as well. Jen Harst, our operations manager, is in her glasses as well. And then Portia Fisher is our only other full-time person outside of me, who's our education and registry manager. Then you have our wonderful intern with a bright future, Nia Watkins, there as well, that will help you. So if you have any questions, you cannot get to me, feel free to chat privately to one of these folks and we would be happy to help you. So, you know, a lot of things have changed about MiCHWA. We changed our new office. We have a new staff. We are still, though, maintaining MiCHWA's core roles in the community. And I'd like to think of those in really four big buckets. We are a convener. We are an organizer. We are an administrator, and we make sure we highlight and lift the voice of CHWs. So just roughly, this means we bring stakeholders. Somebody's unmuted. Got a little background, sorry. We bring stakeholders together. We organize and work directly with our statewide organization and even national organizations. We facilitate our CHW training program and curricula, as well as our MiCHWA CHW registry database that we'll talk about a little bit today. And we are always fostering the support and the voice and elevating that voice of CHWs in everything that we do. So if you wonder what this organization is all about, note, we convene, we organize, we administrate, and we are the voice of CHWs in Michigan. All right, so it's important to level set regarding our policies, activities, and values. So I just did a quick word cloud here that highlights all of the values and guiding principles that MiCHWA's board of directors have sort of documented as important. So we admire integrity, competence, diversity, justice. The CHW partnership is important to us, and we also are partners in stewardship and socially. We also have strong importance in weight and health equity and the social determinants of health. So those are all of the type of values that our organization likes to continue to share. You have any questions about our values or what those actually mean or how we're doing them in practice? Feel free to connect with one of us and we'd be happy to discuss. So it's my turn to talk continuously, for the beginning of this meeting about MiCHWA's activities to date, and I am really pleased to do so. One of the things that I like to sort of frame the conversation as our 4 organization focus areas as they relate to the themes of our annual meeting. So we elevate MiCHWA CHW training program and curriculum. It's very important for us to lift that up. We seek to maximize MiCHWA's member registry that you know formally as the CHW registry. We seek to elevate, maximize, and sustain the CHW workforce in our workforce sustainability and policy efforts. And we always focus on sustaining CHW awareness and recognition. So now that I've done sort of a brief overview of these things, I'm going to go into each one in detail, and there are going to be some polls throughout here that you'll be asked to complete. So just bear with me as we chat. The first one, I want you to tell me, where is MiCHWA's office located? I would love to know if you guys know that we have moved and where we have moved to. So it looks like maybe the poll isn't what I think it is, but you're joining the poll. I'm not sure how we're going to work with the quiz, but thanks everybody for sharing your name. I think I'm going to pass through this because this one didn't work the way I wanted it to. Here we go. Where's MiCHWA's office located? We'll give you a couple seconds. Let's say 30. I know the answer, so I'm going to chime in here shortly, and hopefully you all do. We've got 50 folks who have responded. And let's give folks a few more seconds. I just noted as well, and then we will go from there. I think I'm actually going to stop this poll a little bit quicker than it actually is here. And what we've got here based off 45 respondents, love the annotation, folks, continue to do so. You're right, 56% of you said that our new office is located in Troy. Absolutely correct. We are no longer in Ann Arbor. We don't live in Grand Rapids. We live in Troy, and we are a remote workforce. So if you want to know exactly what our address is, I'll show you that a little bit later. But just know we are a new team in a new office location and reinvigorated to work for our CHWs. Okay, so let's keep it going. Thanks for all of you who responded. Congratulations, Jeremy Lapidus and everybody else who got it right. Isn't this cool? Everybody gets a trophy. All right, let's keep going. So MiCHWA's CHW training program is really critical, a very key component of our work that we intend to elevate on a regular basis. This world that I'm talking about right now is Portia Fishers, our education and registry manager, and she is leading our efforts to standardize our curriculum and training program, making Sorry about that. We're discussing the curricula and training program with national associations and stakeholders, so elevating that voice. We're developing our virtual capabilities in the midst of the pandemic, and we're managing the demand for our training program to participate with us and for CHWs who are newly interested. And what we do on a regular basis to elevate is to advocate for state level recognition of our curricula and training program. So if you want to know how we're elevating you via our CHW training program, here are a few bullets. Let's just kind of talk through the process of MiCHWA's CHW training program, because I think many people wonder how this thing actually works. So a CHW or someone interested in being one starts the process with us by completing a MiCHWA certified CHW training program with one of our wonderful partners. And then we give them access to our membership registry where they are able to document their certification, increase and use their job skills and registry and build it up that way, explore continuing education opportunities and maybe even jobs. And that's what we have there for our registry membership account access. And if you annually connect with us and you load your continuing education credits every 2 years, you will continue to maintain your MiCHWA certification. If you've got any questions about this process, feel free to chat or connect with Portia. Just a big brief overview of our training program. It's really focused in 8 core competencies. And we took the Minnesota curriculum and kind of Michiganized it to work for us. Note that if you're interested in learning more, this is a hefty 126-hour commitment, but it is worth it. You'll learn a lot about roles of CHWs, healthy lifestyles, behavioral health and substance use. All of that good stuff is wrapped up into our core competency-based training program. So here's just a quick year in review. I've been in the executive director for roughly 7 months. Our staff has been here for roughly 3, and we've been able to date to certify over 700 CHWs. We've got over 68 cohorts, which are sort of classes of CHWs that we like to say have graduated. And we've got currently 4 training organizations. If you're interested in what this will look like or participating in the year of 2021, Portia's email is right there for you to email her directly. So let's talk about this. I want to know, are you interested in learning more about our training program? If yes, let us know. Portia will reach out to you. If you're unsure or you already know enough, feel free to say no. I'm going to wait until about 30 people at least chime in here. And it looks like probably no one's interested because you've already done this, and that's wonderful for me to read. And I'm sure helpful for Portia to know as well. So let's keep going. Our membership registry is important to us. If you haven't already learned about MiCHWA's CHW membership registry that now has over 700 CHWs, I wanted to just highlight some efforts that we're taking to maximize our CHW training program and our registry. So we're making the registry more user-friendly. It's now integrated into our main website, happy to say. We've increased and continue to increase the number of organizational partners working with us. We want to increase our allies, and we want to advocate for statewide use of our database. So let us know, have you already become a member with MiCHWA? If yes, click yes. If no, hit no. And if you're unsure, you probably need to check out the status of your of your membership. Feel free to email us at info@michwa.org, and we'd be happy to help. I'm happy to see that over 70% of our respondents are already engaged with us. And if you're one of those folks who's 30% or less and you're at the no, no worries. We'll make sure that we connect with you and give you an opportunity to join. So MiCHWA's membership registry, I call it the 700 plus club right now, because we've got over 700 folks that are members with us, and we look forward to inviting you to participate in our 700 plus club so that we can connect with you on a regular basis. Our membership levels for the registry include both CHW, ally, and organization level memberships. Individual memberships are only $30, and then our organizational memberships range from $200 to $760, depending on the benefits in which you'd like to sort of maximize. So what's new about MiCHWA and how we're trying to maximize this registry is that CHWs and allies and organizations must be an active member with us to gain access to our membership registry and also maintain their certification or their organization status. So I'm not sure if we have any questions in the chat, but feel free, if you have any, to let me know and we'll go from there. I'll also provide opportunities for you to ask questions a little bit later. So our membership registry is pretty dope, I'd say. It's relatively new. We've updated it. It's user-friendly. It's pretty. And membership profiles allow you to really tell us who you are, tell us what county you're in, tell us what type of skills you have, and it also provides an opportunity for folks to network. Our CHWs continue to have an increasing and easier capability of seeing CEU and training opportunities. There are many job postings and resources there, and this is one key that I want to highlight, integrated within our website. So when we talk a little bit more about the website, I want you to acknowledge that the MiCHWAregistry.org web address is no longer in use, and we want you to navigate to the MiCHWA membership registry page that's maintained and housed within our MiCHWA.org website. And if you haven't already been added, wait until November 1, where we will be migrating all of the rest of our active users. But if you're eager now, hop onto the website, create your account, and set up your membership subscription with us. So this is just a preview. I encourage you to explore what this beautiful website looks like for yourself. But what you can see here is just a high-level overview. We've got opportunities to find CHWs and other organizations, job postings you can see, CEU opportunities, and a whole host of resources that used to be available on our public-facing website have now been archived and indexed for your use here. So to date, when I took this screenshot, we had successfully migrated 186 total CHWs, but that number will continue to tick up and be more representative as our 700 club after November 1. So just so you know, we have, like I said, all of these work groups that work to elevate, maximize, and sustain our work. And I wanted to just highlight the activities of our work groups here that are important to what Portia does on a regular basis. We have an Education and Workforce Committee that meets monthly, and they really oversee the direction of our training curricula and the program. If you're interested in that, feel free to email Portia. We have a monthly meeting of our trainers. It is a great and strong bonded group that we meet with on a regular basis that focus on standardizing our curricula and our training program throughout all of our multiple organizations. And then we have an evaluation advisory board that focuses on the evaluation of our curricula that we should do annually. Ladies, I think we still got a ton of people in the waiting room. So our efforts to elevate the CHW workforce through sustainability is really a key. This is one of the most important items that I'd like to stress with you guys today. We work daily to focus on sustainability of the CHW workforce, not only in Michigan, but also nationally. You'll see that as we have a couple national folks represented in today's meeting. We are working with state leadership to add MiCHWA core competencies and training requirements to Medicaid health plan contract language. We're encouraging local and county health departments to work with CHWs with MDHHS. We're expanding our Medicaid contracts to seek more useful and appropriate payment options for CHWs. And we always advocate to state leadership for recognizing that stamp of MiCHWA certification that many of you have already attained. As we continue to talk about this, we maximize grant opportunities. We are seeking to find everything that we can that will lift up models for CHWs being integrated into the CHW workforce and public health infrastructure in our state. We're reviewing Medicaid policy. We're examining existing financing mechanisms for other professions, though, those folks that have been successful in accomplishing what we've been able to do. We're doing our research to make sure we're doing the same thing for our CHWs in Michigan. And we, like I said, are continuing to explore grant opportunities. That might be a duplicate. As we sustain the CHW workforce in our sustainability efforts, we're encouraging state leadership to recognize CHWs, right? Recognize that workforce and lift them up, as well as recognizing our organization. We have deployed a CHW employer survey for 2020, and we'll be launching a brief CHW survey in 2021. And as well as delivering and deploying surveys, we are also disseminating reports of our results to stakeholders, funders, CHWs, allies, and leaders, all in the like. So I'm interested to know, have you guys even seen our CHW employer survey report that was delivered and disseminated on October 2nd? Let me know. Yes, I'm hoping that there are many of you who have said yes. And if you have said no, that means we've got more work to do, and we will consider other avenues to get that out. You'll find that that was sent to our CHW network. It's now on our website, and we have also posted it in our newsletter and on social media. So if you would like to, we'll get it to you. If it's a no, I'm going to make sure we increase that number. So it's actually more who say yes than those who say no. So thank you for your feedback here. All right, let's talk about that 2020 employer survey that many of you have seen and others have not. There were some key implications from that 2020 employer survey for our organization, and those efforts are listed here. I'm not going to go into detail because it's written here on the slide for you to read yourself, but it really helped us understand that there's demand out there for our training program and for our continuing education opportunities, as well as a notification and a desire that our MiCHWA certification status be elevated and recognized by the state. So this is the type of work that informs our policy and sustainability efforts. So I would love to make sure that you guys are able to read and share this. And we're also thinking that we need to provide a supervisor training for CHWs, since there are so many supervisors, allies, and stakeholders on the call who are invested in CHWs and would love to continue to learn more about our training program. Just going to do a quick time check. I'm at 9:30 and I still have about 15 minutes to get through this presentation. So bear with me, ladies, and we still have people in the waiting room. MiCHWA's advocacy efforts are really important. You'll find an Advocacy 101 session was available for you to register for today, but let's talk about how we're advocating for CHWs as it relates to the pandemic, unfortunately. This has been a really tough time for our state, right? We're all virtual. This is normally an in-person thing, but our country is in mask and, distributed at home, right? So we have to continue to advocate for the CHW use in our COVID-19 efforts. So this just relates to making sure our legislators recognize the roles that CHWs may have in providing outreach and education, in connecting folks to services, and also participating in testing and contract tracing. So we meet regularly with our state legislators and also national health and human service officers to make sure CHWs are lifted and their roles and opportunities highlighted as being able to greatly impact this span of the pandemic that we are currently in. So our sustainability efforts related to our work groups are highlighted here. Our education and workforce are focusing on standardizing our curriculum. CHW Policy Work Group meets monthly that's focused on operationalizing our board-approved policy agenda. We've got an evaluation advisory board that meets monthly that focuses on those surveys that we deploy and also distributing those reports that we eventually create. So if you're interested in partnering up with us to show how useful CHWs are, feel free to email me or email info@MiCHWA.org. The last focus area that I wanted to talk about from the organizational perspective relates to sustaining CHW awareness and recognition. We seek to offer CHW scholarships as much as we can to our active members. We promote CHW awareness via social media. If you recall, August of 2020 was recognized by Governor Whitmer as CHW Appreciation Month, and we have requested that tribute and recognition yearly, I believe, since 2014. So that's an ongoing effort of ours. We are distributing a monthly newsletter that highlights our CHWs, what's happening in that space, as well as spotlighting unique CHWs every month so that we can highlight them. So if you're interested in participating in our advocacy and awareness, I'd encourage you to meet and reach to get more information regarding our communications network and our CHW network, who really do drive our communication and marketing practices, as well as lifting up the voice of CHWs in our world. So this is very important for me to note. If you want to participate in our awareness and advocacy efforts, get connected with us. All right. We have a new home, like I shared before. Our address is in Troy, and we have Facebook, Instagram, Twitter, and I think the last one is YouTube channels and social media. Nicole and Nia are awesome at scheduling and maintaining these flat platforms. And we often have opportunities that we share through our network for folks to take action with us. So that can mean signing up with our call to action for the state of Michigan, or even just telling us what you're feeling or what you're thinking as it relates to the workforce, writing letters and joining in on legislative activities that we may do. So please get connected with us, join our listserv, and feel free to join and work with us, as we are a hub of, various stakeholders that we'd like to bring together. Have you followed us yet on social media? I shared we've got Facebook, Instagram, Twitter, and a YouTube channel. And I just like to know how many of you are aware of our social media platforms, our handles, and if you have followed with us. If you haven't, feel free to do so now. Nicole, please put in the chat the handles for our social media for folks to follow throughout the meeting if they'd like to. All right. Oh, looks like many people haven't followed us. So Nicole, we've got some opportunity here to keep these things going. Love to increase our engagement via social media. All right. So I'm really ready and happy to launch our new MiCHWA website. So if you pull up your browser, pull up your phone, I encourage you to navigate to MiCHWA.org and see the change that has happened as it relates to our website. I could highlight it here, but I really want you guys to pull it up, click around, get connected, learn a little more, and see what we are up to as it relates to our new website. MiCHWA.org should navigate you to a more modern and friendly website that we hope that you are able to utilize and find useful. And if you have any questions, comments, or concerns, always feel free to reach out to Jen or myself, and we will be happy to help you. I believe that our website developer may be participating in our call today. And if you love our website, I encourage you to reach out and I will get you connected with our developer who helped bring this up to speed. And thanks to Jen and Ronnie, our developer, for getting this together. I think that deserves a round of applause. So I'm just going to take a second and just give up a round of applause for our new website. All right, let's keep going. I want you to get involved. I want you to contact us at MiCHWA.org. And I first want to give you guys an opportunity to ask me a few questions, if you have any, for maybe the next 2 minutes. So make sure you join us at Slido. You're participating in the general session. I'm going to see if we have any chats. Okay, there are 99 things here. I'm not going to be able to sift through it, but I do not believe I see any questions. But feel free to utilize Slido to connect with us. And thank you all for engaging via social media if you have not been able to connect via Slido. All right, let's keep going. So we're in the space where we want to thank all of our partners. And first of all, I love to thank my wonderful board, our MiCHWA board of directors, many of them founding members that come from organizations that you see highlighted on this slide: Henry Ford Health System, the University of Michigan School of Social Work, Cherry Health, a Michigan Minority Health Coalition are all active and eager partners that help drive this organization. And I just wanted to openly thank you for your leadership and for the direction that you're able to provide the staff and myself to really execute. So thank you to our board members. I know many of you are on the call. You'll hear from our future president a little bit later in the day. All right. We absolutely want to first ask you guys if you're interested in joining a leadership position with MiCHWA's board of directors. We seek to elevate the voice of MiCHWA. We seek to elevate the voice of CHW. So we are really interested in reviewing the profile of our board, and we want more CHWs. So if you're interested, please say yes and no, that I'll contact you if you are interested, when we start to sort of develop our opportunities for expanding our board of directors to include more CHWs. But that's not only the leadership opportunity that we have. You can be a leader if you participate in any of our work groups. So feel free to reach out if you'd like to not just do the board of directors, interested in any work groups. We are happy and definitely willing to have you. And thanks for everyone's responses in the chat. I'm really appreciative that you're finding your ways to connect with us. I forgot to record this meeting, so let me do that now and resume recording, I think, so we can make sure we're keeping track of all of our chat. So now that we've thanked our board of directors and we have highlighted our board of directors, let us say thank you to our sponsors for this year's annual meeting. It's been a little different, right? It's a virtual annual meeting. You're used to being together in person all day in Lansing, and we're just here sitting at home, connecting, or sitting at work. But we wanted to thank our sponsors who were able to provide an ally sponsorship with us: Hamilton, Michigan Primary Care Association, Blue Cross Complete, HAP, and then McLaren Health Plan. Thank you. And many of you are here today. And I just wanted to thank you for your sponsorship and your continued support of our organization. And I'd also like to thank our patron and supporter sponsors who also decided to chime in with us and support this annual meeting. Those include the Michigan Association of Health Plans, Molina Healthcare, Priority Health, Michigan Public Health Institute, MiCHWA's, which is in Detroit, a community health and social services center, and then the Michigan Minority Health Coalition. You'll recognize many of our sponsors are also board members. So we want to thank you again for your commitment and your dedication to our organization and our meeting today. Okay, so let me do a quick time check. I'm going to pause my screen, give you guys an opportunity to share if you have any questions really briefly before I go into really introducing our keynote speaker for the day and sharing with you a little bit about their bios in preparation for our conversation. I believe that we are a little bit ahead of time, so that is actually wonderful. Maybe we'll take a 10-minute break before we go here, but do we have any questions for anyone so far? No questions. Everyone is thanking us for our sponsorship and things of that nature, and we're gonna go on from there. No questions?
Janae, this is Jay. Can you hear me? Okay, so I was seeing some questions as this is a lot. This chat is on fire. So it's hard to keep track of it. And I think we should call out some of them so that if other people are missing the questions and the answers as they happen too. So for example, I saw Courtney ask, do you have to be a CHW to join one of the work groups? And you do not. Anybody can raise their hand to join a work group. We just want you to be a member of MiCHWA. And Janae went over what those fees are. They're so minuscule. And if it is problematic for you in any way, you can let the board of directors know and we will negotiate that for you. There was another question I'm scanning for that was about putting your continuing education credits on the registry now, and if that's easier with the new site. I can't find it now. I don't remember who asked it.
Yes, someone asked that question, and Nicole recorded their information and said that she would be getting with them later today.
Wonderful. Well, let's just talk about this MiCHWA registry. I'm actually going to log in here so you can see it, and maybe I actually shouldn't. I'm going to just not do something off the cuff. But this new website and registry is much more user-friendly. We get notified as soon as you upload a certificate as pending for us to approve. It's very quick and easy for you to do so. You'll get an interview, you'll get an email from us once we've been able to review and approve them. So it's all about increasing the functionality of the personas of our CHWs, our allies, or our stakeholders who like to participate. So let me first just say thank you to Jay, who is our current VP, future president that you will hear from later, for chiming in and making sure we're asking questions. I'm glad that you guys were able to hear from her voice. And I just echo, please work with us. You do not have to be a CHW. I'm not a CHW, right? I don't even have experience as one, but I love the workforce and I'm dedicated to it. So if you're like me, you're interested or don't know enough, maybe thinking about want to become a CHW one day, we encourage you to join. So someone asked, will there be a CHW certification training coming in 2020? Actually, we've got a few cohorts who started 2 days ago. We've got a couple who are starting next week, and we're already planning for 2021. So if you are interested in joining that MiCHWA certification program, please email pfisher@michwa.org. Portia, put your email in the chat so we can share that. I'm trying to scroll through and make sure we don't overlook any other questions that we have here before we proceed on with the annual meeting. So if you have any questions, I encourage you to share them. And if not, I'm going to go ahead and introduce our keynote speakers here, and then we'll go for a break, maybe 5 minutes or so. and then we'll come back and we'll launch, and the voice you will hear will no longer be mine, but it will be from Shreya Kangogi and her counterpart, Ashley Harris, who will be presenting our keynote speaker. So I just wanted to highlight and first thank them, all of our speakers. I will, introduce more of our speakers later before we break out into sessions, but I wanted to thank Shreya and Ashley for participating from the Penn Center for Community Health Workers. They are becoming, or are known as, the National Center of Excellence for Community Health Worker related activities in the United States. So we're pleased that they have found the time to join us. And it looks like Ashley just entered the waiting room. Ladies, please let her in. The title of their theme is going to be A People's Movement for Health. So that's the topic they're going to talk about today. And I just like to briefly give you an overview of Dr. Shreya Kangogi. I'm not going to read this. I'm going to give you my introduction of her. I believe that she is innovative. She's different, right? She thinks a little bit differently, and you'll see that from her today. She is an advocate. She is a leader, but most importantly, I think she's personable. The first time I met with her, she asked me, let me get to know you before we dig into the meat. Kind of threw me off a little bit because I'm a type of person that has an agenda. I'm ready to tackle it and get it done. But she's like, let's level set. Let's introduce ourselves and learn a little bit. So we talked about our dogs, we talked about our families and what it's like working from home. And the same with Ashley. She has been an advocate and a leader. She is a CHW, right? I want to make sure that you guys see the intent that we have to lift up the CHW workforce and the voice in everything we do. So that's why you have a leader of a community health worker alliance or an organization, but she's supported by Ashley Harris, a CHW. And I think she's been working in Philly for over 4 years. Don't know, but a quick fun fact that you guys might learn something new about me is that I went and got my master's from Philadelphia. So I feel like these ladies are, a family to me, because I know, where they are and where they're kicking it and where their work is actually done. So Ashley's been a CHW for over 4 years. She really became one as she shared her story with me when I met her, because she's like, this is what I do every day. I advocate, I love, I care, I connect. So she decided to become a CHW. And like I said, they are both leaders nationally for what CHW roles and work actually look like. So I've actually done this a little bit quicker than the 5 minutes that I said. And I think that's perfectly fine, because if you're like me, you could use an opportunity to break, stand up, stretch a little bit. And I just encourage you all to come back, let's say in 10 minutes at 9:57, so that we can go ahead and kick off our keynote address, and you won't hear from me after that. So stand up, take your dog out, do what you got to do. We'll be back with you in 10 minutes. Hi, everybody. I just wanted to remind you, if you're still here, to maintain your muted microphone, please. Hi, everyone. If you can still hear me, this is just a 2-minute invite back to the meeting. We'll begin again at 10 o'clock. Okay, if you can hear the sound of my voice, I'd like to just encourage you to come back to your computers, turn your videos back on, and let's keep this conference going. While we're waiting and folks are coming back to the screen, I'd just like to apologize. If any of you have had technical difficulties, I can see from my email a number of folks unable to find the invitation. Feel free to include your experience in the evaluation form that you send so we can make sure we do better next year if we have to do anything virtually. But I hope that you've been able to get connected. If you've got coworkers who cannot get connected, go ahead and send them a Zoom link or invite them to the calendar. We want to make sure as many folks who are interested are able to participate with us today. Okay, we've got about 1 minute left. I'm going to share my screen in preparation for our wonderful keynote speakers to speak with us today. And I am going to go ahead and unmute Shreya. And I'm also going to go ahead and unmute Ashley. And I'm going to mute myself in just a second. And I just wanted to make sure that you guys know that you can engage, you can ask questions, you can do whatever you need to connect with us and participate in this annual meeting. So hopefully you can see my screen. And in just about 30 seconds here, I'm going to ask that Shreya and Ashley kick this thing off. And like I said, I'm looking forward to this conversation. So I'm going to go ahead and ask that you guys begin at your earliest convenience.
Thank you so much, Janae. My name is Shreya Kangovi. Ashley, I'm not able to see you, but I think you're on. So I'll give you a moment to just say hi and I can jump in.
Hi, everybody. I'm Ashley. My camera's on. I'm not sure why you can't see me.
I can see you now. Okay, great. Just there's so many faces, Ashley. I was like, where is Ashley? I just need to start by saying, wow, Michigan. Wow, Janae. I thought I knew how to run a meeting, but I think Janae knows how to run a meeting. And I am so blown away by the just firepower in the Michigan Community Health Worker team and the leadership structure. You all are out front and a force to be reckoned with. And I'm just really, really excited to be spending time with you here this morning. Our talk is titled Community Health Workers, a People's Movement for Health. And I think that is an apt title in our current times because we have known for a long time, but it's been never clearer than this moment that social justice is the key ingredient of health, and injustice is what has kept many of us unhealthy. And community health workers are the frontline workers on the pandemic of injustice, which is actually the deeper pandemic. We're not in the middle of a new coronavirus pandemic. Coronavirus is just a symptom of the deeper inequities that have always made Black, brown, and lower income people sick. And you all in this room today are, I think, the answer. So I'm really delighted to be here with you. And let's get started. Next slide, please. Just to begin, I'm going to give you all a quick overview of the center that Ashley and I work with, which is called the Penn Center for Community Health Workers. Our mission, as Janae alluded to, is to achieve health equity through effective partnership with community health workers. We serve this mission through 3 sets of activities. When we started doing this work about a decade ago, we started with, I think, good formative science. And I know that when many of us hear science, we think ivory tower, we think elite, and that's not really what science is about. I know that often is who scientists are and how they operate, but science is about truth. And where we went to find the truth was to the streets. We went out on porches, shelters, hospital bedsides, and basically interviewed about 1,500 individuals who live in chronically disadvantaged communities. And we asked those people what made it hard for them to stay healthy and how they would design a program to improve the situation. We audio taped all of those interviews, we transcribed them line by line, and we analyzed what people were telling us. And we used all of that input to design impact, which is a standardized way to hire, train, and support community health workers and help them to do their best work in making their communities healthier and have better lives. And we'll talk a lot more about that in a minute. We took this packaged up model called Impact, and we then tested it in 3 separate randomized control trials, which is the same way that you would test a new drug or a medical device. And we found that this way of constructing community health worker programs moved the needle on a lot of the outcomes that we all care about for our patients and communities. It improved access to primary care, improved the quality of the care that they received from the healthcare system. It actually improved mental and physical health, things like helped people quit smoking, helped them lose weight, help them lower their blood pressure. It reduced hospitalizations, and it saves money for Medicaid. It actually returns $2.47 for every dollar invested by Medicaid within the fiscal year. On the basis of these outcomes, we've been able to achieve some scale. So in the Philadelphia region, which is our headquarters and our flagship, we have a direct care program, which has served over 15,000 individuals. We're increasingly, though, focused on national scale. We partner with organizations in about 18 different states, and we help them to plan, build, and run community health worker programs that are locally tailored, but built in alliance with some of our best practice principles so that they are, again, set up for success. So we have that national network, but the other area that we have been starting to focus a lot of energy on, and that we're going to talk to you about today, is thinking about how policy and financing initiatives can actually be really leveraged to promote community health workers and to elevate them, as you know, in line with the theme of today's conversation. So that is just a high-level snapshot of our center and some of the work that we do. You can go to the next slide. Thank you. Now I'm going to turn it over to my colleague, Ashley Harris, who is a community health worker, and I'm going to ask her to introduce herself and tell us a little bit about the work that she does.
Hello, everybody. So again, my name is Ashley Harris, and I'm one of the community health workers. So basically, a little bit about myself is I was raised in Philadelphia, and I still currently reside here. I actually live in the North Philadelphia section of the city. And I wasn't raised with a silver spoon in my mouth. I actually was raised by a single mother, and my mom became disabled as a child because she was hit by a drunk driver. But she never let her disability hinder her from doing anything. She actually just used her experiences to help other people. She even went on to help write the policies and procedures for the Americans with Disability Act, the ADA in Philadelphia, which basically was geared towards like the housing and employment for individuals. Myself, I definitely have overcome a lot of challenges in my life, but just like my mom, I use my life experiences to help everybody on an everyday basis. So now I'm a CHW and I work with Penn Medicine. So basically what I do on an everyday basis is I reach out to people who live in the community. I provide them with support based on who they are and what they need. And the key factor to while I'm working with them is I listen to them. I don't talk at them. I want to get to know them. I want to understand their life story, who they are, and what they've been through. So therefore I can help them better. So like, for example, I met a gentleman by the name of James. And James was referred to me because he was struggling with drug addiction. But when he was referred to me, he was like basically labeled as being difficult. But in all actuality, they were actually intimidated by James. So when I sat there and I talked to him, I listened to him, you know, we laughed, giggled, all of that good stuff. And he actually was a sweetheart. Like, I didn't feel like James would hurt a fly. Like, I'm like, you guys are tripping. Like, he's so cool. Like, that's how I felt about it. But as I talked to him more, I got to pick up deeper issues, basically. I found out like he was involved in a tragic incident where him and his sister were using. And his sister, unfortunately, she had overdosed, right? So James was charged with that. And he was also blamed by his family. And he never recovered from that guilt. So one of the big things that I wanted to do while I was working with him was I wanted him to feel love, like somebody cared about him. You know, if you feel like your whole family is against you, you don't have anybody, you know. So I made him a love package. And in the love package, I included like all of his favorite snacks. I included like underwear, toiletries, and pajamas, which was really a big, big hit for him. And I didn't think too much about pajamas, but it meant a real lot to him because he hadn't worn pajamas since he was a kid. So from that, he did feel love. He felt like somebody cared, you know, and that got him motivated to have hope for his own future. And from there, I got him enrolled in a literacy program, and that got him on the path to recovery. So that was some amazing work that I'll always be proud of, like something like that. It was another woman that I had worked with, and her name was Alexis. So Alexis was a young lady. She was like in her early 20s, and she had sickle cell, and her sickle cell was like really, really bad. So bad that it interrupted her college education, and she had to drop out. And you would think you would get discouraged, you know, you're sick and you can't even go to school, you know, to better yourself. But that didn't discourage her. That actually, I think she had more drive, and she was still vibrant, and she still had hope. Like, she didn't pity herself or anything like that. So one of the things that Alexis wanted to do was she wanted to start a sickle cell support group, because she felt like in the hospital when she goes there, because she's Black and she has sickle cell, she's targeted. Like, she just automatically thinks that she's drug seeking, which isn't the case, and they don't really understand. So I helped her start our sickle cell support group. We made flyers, we made posters, we hung them everywhere. We got a lot of people to show up and show out for, which is a good thing. And from there, I just felt like it not only helped her, but it also helped like the families who has sickle cell, or family members who had it, you know, because if one has it, you're all dealing with it, you know. So it helped them to be more educated and feel like, you know, you had some type of support. So that was a good thing. But during the course of all this, I actually, which was a great takeaway, I got a chance to educate some of the doctors and the nurses who were involved in Alexis' care. And that meant a lot, because I got them to understand that everybody's not drug seeking, you know, and get them to understand that this pain is real and everybody's pain isn't the same. So you got to treat people differently, but still have a heart. Talk to them, you know, treat them with compassion, have sympathy, you know. So that was the greatest takeaway, educating them so that they know how to treat the next person that comes through the hospital, or who's admitted to the hospital. So, excuse me. I hope this gives you all like a better understanding of who I am and what I do as a community health worker. And thank you for allowing me to talk.
Thank you so much, Ashley. I've heard you, I've heard you speak a lot of times, and every time it blows me away. Not only because you are an eloquent public speaker and because you do amazing work, but who you are as a person really shines through. And that's one of the most powerful things of being a community health worker ally, is that over the years, I've gotten to realize that community health workers are truly the best of us. There's no one mental model of who a community health worker is or what he or she looks like. This is about holding up a mirror to all of the most hardest hit communities across the United States and reflecting the best of us. And, you know, I think you guys could hear in Ashley's story that there are so many ways in which community health workers can target the trajectory of social injustice before it leads to poor health. Yes, community health workers can work within healthcare and help, get people hooked up to medications and doctor's appointments and things like that. But they can even go upstream from there. You can help people get access to things that improve their living conditions. You can help actually work with people on behavior change, but you can also influence policies, and you can change the psychology of the people who are actually creating the oppression in the first place. Health inequity is a psychological disease that affects the privileged, people like doctors, nurses, policymakers. We have problems like racism and greed, and that makes its way into public policy. And those policies shape the distribution of wealth and power across society. And that affects James's living conditions, and that affects Alexis's behavior. And then that makes people sick. And community health workers can work their way all the way to the root of the problem. And the most powerful part of Ashley's testimony was hearing her with grace educate the clinicians who are kind of at the base of the pyramid of this power structure. So thank you, Ashley, for that. And it's really exciting to see the chat blowing up. Do y'all feel like Ashley's story resonates with you as community health workers? Is this sort of the vision for who you all are and what you hope that you can achieve? I'm seeing some immediate yeses. I think that is the goal of telling this story. Ashley told the story to let you all know a little bit about who she is, but I think that one of the real goals is to affirm who you are as a community health worker. This is who you really are. Community health workers are people who, number one, share life experience with people they serve. And number two, have a personality type, have trust building traits like empathy, altruism, who are listeners more than talkers. That's who community health workers are. And what they do is they get to know people, they listen, they learn life stories, and they do what people think they need in order to improve their life and their health. Y'all are not box checkers, you're not care coordinators, you're not case managers. Don't get dominated by the medical industrial complex and lose this Ashley story. And that's why we wanted to kind of start with that. So when we talk about this vision of who community health workers are and the magic that you all can do, if we can go to the next slide, the stories that you just heard from Ashley were magical, but they were not accidental. And that is because Ashley herself was hired using a specialized hiring toolkit that my team and I have developed and iterated over the past decade. We have been able to figure out how to identify, in a hiring process and recruit individuals who share life experience with the people they serve and who have those trustworthiness traits like empathy and altruism and listening skills. And we use organizational psychology-based strategies to selectively recruit people like Ashley, who are not just, CHWs because of the letters behind their name, but because of their heart. And that actually has translated into major improvements in our turnover rate. In an industry that has an average turnover rate of 50 to 77% per year, what we've been able to do is maintain our turnover at 1.7% over the past decade. So that is really remarkable. And being able to recruit and retain people like Ashley in this role is a critical part of making this magic happen with consistency. You can hit the next slide. The questions that she asked when she gets to know patients like James or Alexis come from playbooks that my team and I, and again, everything that we do is co-designed with patients and community health workers. We've developed these work practice manuals, playbooks essentially, for how you get to know people, how you listen to them, how you ask them, what do you think you want to do in order to improve your life and your health, and how you turn that into action plans and goals. So all of this is grounded in social and behavioral science theory and operationalized in the form of these work practice manuals. Next slide. Ashley documents, when she does her work, she's able to document her notes in an app that we co-developed with community health workers. And that's a different experience than documenting in the EMR or a case management software that wasn't co-designed with community health workers. Next slide. Ashley receives supervision from a trained manager who we also specially hired because of their ability to provide supportive supervision and to really understand the grassroots workforce. And these managers are trained using our interactive online training platform. So all of this is to give you kind of a peek behind the curtain of what CHWs like Ashley need in order to do the magic story. And so what I want to do next, if you go to the next slide, please, is just to hear from the crowd, what do you all think community health workers need in order to do their best work? So we'll just give people 2 minutes to kind of scratch their heads and just put, just a couple word answers into the chat. What do you need in order to do your best work? What are some of the behind the scenes pieces? Good, I'm seeing compassion and empathy, flexibility, support, listening skills, compassion, the desire to be of service. So this is amazing. And this is the first layer of answers that community health workers always give, because you are thinking about what you need to have intrinsic to yourselves in order to be of service, which is just the way that you are wired. That is definitely critical. Also tell us in a more selfish way, as we're starting to see now, what do you need for you in order to be able to do your best work? And I see a secure budget. I see co-developed tools, money, supervision, time, separating work and home life, compensation, solid boundaries, compensation, I'm gonna say that again, leadership opportunities, self-care, resources, self-care again and again and again, because you all are the people who you serve. So all of the circumstances that James and Alexis are struggling with, you have survived and you are still experiencing. And this workforce, if you look at the history of community health workers, is often marginalized, is often exploited, and absolutely cannot be viewed as expendable or as the bottom of some hierarchy. So you all need to be supported in taking care of your own self. Okay, this is excellent. And we're starting to hear all of these great ideas. Keep this chat going. We're going to keep moving into the next slide. So here are some of the things that the last several hundred years of community health worker programs and the science that has come from those programs suggests are the inputs to magic. In other words, these are some of the things that community health workers from like 200 years ago, in the Chinese Barefoot Doctor program and the Russian Feldsher program, all the way through the Indian Health Services, we are standing on the shoulders of giants, right? The community health workers have come before us. And fortunately, there have been some scientists who have been partnering with community health workers all along the way to learn from them what works and what doesn't, what sets you up to be able to succeed. And here are some of the lessons. Number one, you need to hire the right people. This is not just something where it is based on some letters behind your name. And many of the answers in the chat reflected that. This is a calling. So hiring people who truly share life experience with the people they serve and who have the certain personality type is critical. Compensation and career ladder. You all need to be paid. You need to have a secure funding stream. This can't be about grants that run out and run out and run out. When I first started doing this work and interviewed candidates for the CHW role, it was heartbreaking because they were incredible people who should be just secure financially, and yet they had been laid off so many times when the grant ended. That's nonsense. And there needs to be a career ladder, and the career ladder can't just be, oh, I'm going to go be a nurse after I'm done, or I'm going to be a social worker. Community health workers have their own profession, and that is their profession. And there should be room for advancement and promotion and raises within that profession. So compensation and career ladder. Training, absolutely critical, but it's not just for community health workers, it's for their supervisors and it's for program directors, right? Oftentimes you guys are trained, but the people who you work for don't really know anything about you or how to support you. So there needs to be training at all levels, playbooks and a workflow. And so what this means is that a lot of times the substance of what community health workers are asked to do is not quite right. You're asked to go meet a patient and get them to come in for an appointment, or get them to get their mammogram, or whatever, keep them out of the hospital, whatever, you name it. That is not only unethical, it is not really gonna work, because that's not trustworthy. Telling people what to do doesn't build trust. It doesn't actually address the social determinants of health, and so it's not going to improve their health. Instead, community health workers need a workflow and work practices that are grounded in science and in evidence. And the way that that actually works is that the evidence-based workflows is that community health workers do what Ashley did. They talk to people, they listen, they get to know their life stories, and they ask each person, James, what do you need in order to improve your life and your health? And they do that, whether it's buying somebody pajamas, taking them bowling, or organizing a virtual funeral. It is not about the biomedical agenda. Staffing ratios, that's what it means to have time. I heard time come up in the chat and flexibility. You need to have manageable staffing ratios. You can't have caseloads of 200 and 300 patients if you're gonna do magic. You need to have manageable caseloads. Supervision, you can't just report to the next clinic nurse who happens to be available, even though she knows nothing about grassroots work and just hasn't done this type of work before. That's nonsense. That person's not going to be able to support you. So supervision ideally should come from people who are former CHWs, or at least who have grassroots experience, maybe have a public health or social work background, but more are grounded in the social determinants of health. And just as important as community health workers having a personality type, these supervisors need to have a personality type, and they need to be supportive. Oh, I'm sorry. Staying on this slide a little too long. If we could go back for one quick second. Documentation is key. Not having community health workers over document, or document in a way that really promotes episodic fee-for-service clinical encounters with patients. A lot of times when community health workers are forced to document in the EMR, they become medicalized, and that is a problem. Performance assessment, sometimes community health workers think they're doing a good job just because, I don't know, we all think we're doing a good job, or sometimes they're not sure if they're doing a good job. There needs to be a good way of keeping community health workers transparent and making sure that everybody is able to do their best work for people like James and Alexis. And finally, most importantly, safety. Community health workers are not an expendable workforce. We need, at Impact, our #1 value is community health worker safety. We will never put a community health, and we have a ton of safety protocols that range from, in a pandemic, of course, keeping people safe at home, or at the very least, arming them with adequate PPE, all the way to protect them from bed bugs or neighborhood violence or self-care. So community health workers absolutely need to be protected in this work and in their role. So these are some of the inputs to magic that we think have emerged from the science. I'm seeing a lot of stickers that I did not know you could do on Zoom. So I'm loving that. And I'm seeing some chat that this resonates. Can I get a quick kind of gut check? Do these resonate with people as the things that CHWs need in order to do their best work and to have a good work environment? Okay, all right, good. Let's keep it moving. I feel like we're on a good roll. So now let's take a quick step back and think about, how has this issue been approached in the past? And you can go to the next slide. So there has always been this question in the community health worker field: how do we ensure the quality of the work that community health workers do? And to some extent, how do we advance the workforce, right? These questions are not new questions. People who are paying community health workers want to be sure that the dollars are being well spent, that there's no fraud. The workforce and, historically, a lot of state associations have wanted to be at the table, have wanted to have financing, have wanted to legitimize the workforce and advance the workforce. So these goals of quality and labor are not new to us. Next slide, please. Historically, the approach that has been taken to achieving these goals has been, okay, let's train individual CHWs and certify them after they have completed an approved training course. Now, that is very reasonable and very well intentioned. And in fact, that is the way that we do things in healthcare. I am a doctor and I have come through the system, and I can tell you that the first thing that we want to do for anything and anybody is train and credential, you know, like it's about the training, it's about the letters behind our name. And while it seems so logical, like, right, don't you want the best trained person to do the work? I want you to know that there is a little bit of a social injustice threat here, because training and credentialing can also be an elitist filter for people. And if you hit the next slide, we'll talk a little bit more about that. So what have we actually learned after the couple of decades or so where we've had training and certification? There was recently a study done by AHRQ, the Agency for Healthcare Research and Quality, that showed that despite all of the best intentions, training and certification does not appear to have any effect on the quality of community health worker programs. And maybe that's not surprising, because we haven't done anything about those other buckets. When we are just focusing on how Ashley, you know, or some other person is trained and certified, that may not even be the right person to be in the role, and they may not have the right work practices or supervision. So it doesn't seem to have an effect on quality. And in fact, it has a perverse potentially effect on labor, because it can set up community health workers to be co-opted by other people who aren't truly, you know, people who share life experience with the people they serve. Any nurse from the suburbs can take a course and get a CHW behind her name. And as the money starts to flow to you all as a workforce, you better believe that is going to happen. So the more we tie financing to the training and certification, the more this field is set up to be co-opted, and the more we are going to weed out natural helpers who maybe can't afford the training and certification, or, you know, maybe just weren't like, had a 6th grade education, but they are an amazing person who is very intelligent, and so they wouldn't even approach something like that, or they have a record, or all of those kinds of things. So be cautious of the emphasis on training and certification. If you hit the next slide, we can talk about an alternative to that. What if financing for community health workers was actually linked to those magic inputs that we all got really psyched about? You know, hiring, compensation, career ladder, supervision, work practice. That actually seems to work. And we know that from global implementation science. And the cool secret to this is that if we develop standards based on those inputs, we would not only be achieving quality, but guess what? These are labor standards. This is creating a labor platform so that community health workers can actually work in a good environment. And that is the hope, if you go to the next slide. So one of the things I'm really excited to talk with you about is that this is not a dream. This is now, this is actually happening. We are partnering with MiCHWA, which is the, you know, one of the largest quality and accreditation and standards development agencies in the United States, as well as all of these other organizations across the country in developing national community health worker standards. And we call them community health worker standards, but actually they are standards for employers of community health workers, because they're the ones that have the budget, they're the ones that have the power, and we want to ensure that they don't exploit people like Ashley or like all of you, and there are some guardrails. So a little bit about the process. The standards are being developed by a steering committee, which is made up of 50% community health workers. It is science informed, and we are inviting all of you to attend an upcoming public listening session that as soon as it's scheduled, I will absolutely be in touch with your leadership team and let you know. But we want to open this up to community health workers all across the country to hear from you all about what should be in these standards. Next slide, please. So that's the standards. The next piece is just really quickly, I want to talk about our policy and financing strategy. So, you know, this is a moment where I think hopefully the United States realizes that we need community health workers if we are going to stem a public health crisis, save jobs, and rebuild trust. And we need to scale up Ashley stories all across the country. In order to do that, we need to do three things. Number one, we need to create sustainable financing, no more grants that kind of come and go. Number two, as we just talked about, we need to ensure quality and labor standards. And number three, we need to prevent this workforce from being co-opted by healthcare. It is a very dominant culture. It'll gobble you all up and it'll make us into box checkers, and that can't be into, you know, fee for service clinical machine. So what I think, if you hit the next slide, we are really starting to put together a policy framework to achieve these goals. I'm not going to go into great detail here, but number one, we're working closely with CMS so that they can clarify that Medicaid covers the full range of what community health workers do, not just the clinical roles or not just the fee-for-service roles. In other words, Medicaid should pay Ashley to buy pajamas for James. And until that is covered, you know, not as a check item, because there's no CPT code for buying somebody pajamas or doing a virtual, you know, dance party or funeral, but rather you have to have an umbrella payment for people like Ashley to overall do the range of services of getting to know people and providing tailored supports that they need across the domains of social, behavioral, economic, and health coaching. So that's some work that we're working with CMS to do. I think we lost the slide. I'm just gonna ask to advance. So that's with CMS. We're asking CDC to get y'all the money. You know, there's been a lot of money for COVID that's been directed to CDC grants. Those dollars need to find their ways to community-based organizations, especially community health worker and promotora associations. We're working with Congress to introduce legislation that would create an optional Medicaid benefit for community health workers. And throughout all of this, we are trying to be intentional about tying the funding to those labor and quality standards. So that's our policy and financing agenda. I'm gonna ask for the next slide and turn it back over to my colleague, Ashley, to close us out.
Okay, so I just wanna thank everybody, you know, for having us. It was an honor to speak with you all today. I pray everybody leaves here today feeling more confident than they did yesterday. Because myself, I'm not always the most confident because of our profession, because it isn't really recognized or respected as it should be. But sometimes I just have to check myself about it, because I know all of the hard work that I put in and I do when I'm working with somebody. I know how good I make them feel. I know the impact that I have on them, you know, and I already know that what I'm doing is already self-rewarding in itself. So if we believe in ourselves, you know, speak with a clear voice, don't let our voices get manipulated or muddled, we could take over CHWs. I'm just saying. So basically, like, we just need to come together and form a people's movement, a CHW movement, and build each other up, you know. And again, I thank you. I'm gonna shut up because I'm talking a little bit too much. So thank you all for having me here.
Thank you both. That was wonderful. I just want to actually just open it for questions and just thank you first for the awesome presentation. The two of you are dynamic. You can tell from the chat, everybody is excited and re-engaged, and I feel elevated, maximized, and sustained. So let's just go ahead and open up questions. If you guys have any questions you would like to ask, feel free to put them in the chat, or you can add your questions via the app in Slido. So just want to open this up. We have 8 minutes left before we're going to go through another break, and want you guys to be able to ask these two wonderful people, these two wonderful women, what you want. I don't see any questions coming in.
Y'all gonna make
Everybody,
me cry.
go Ashley.
I'm sorry. I'm reading the comments.
Are you crying?
I'm about to. Because I don't think that it's such a big deal, but you know, I want us all to win. I want us all to get what we need as CHWs, you know, even for ourselves, you know, even to help individuals that we work with. So this is great. Thank y'all.
Thank you. So we have a question. Folks are interested in the playbook. Is it available to others, Shreya?
We offer it through our technical assistance program. You know, there is a process. What we used to just share just the playbook, and it turned out that, you know, I think it was helpful, but it's like hard enough to put together an IKEA bookshelf from reading a manual, let alone to build a complex socio-behavioral program. So what we do now is we just build that into the whole package of technical assistance, where we work with all sorts of other organizations, some community organizations, public health departments, healthcare organizations. We help them to plan at a very high level their CHW program. We help them to actually hire on the ground, then train, and then use those playbooks for their actual day-to-day workflow, use the data infrastructure, and then we're kind of by their side for ongoing management. So that is absolutely available. And I'll put our website into the chat, and there's information about that. And if there are, you know, smaller grassroots community-based organizations that maybe need to talk about the pricing for any of that, that is also something that we absolutely can offer. We actually just recently got a grant from Johnson & Johnson that will cover some of the right time to check us out and see if that is something that your organization may be able to use.
Thank you. We got one from earlier that we missed. The importance of CHWs is evident. In Pennsylvania, what are the qualifications or experience required to be a CHW, and what's the average pay?
So Ashley, you're actually on the PA certification board. I don't know if you know the answer to that question. About the
requirements. I just sent a link to everybody so that you can see it, about the requirements and the domains and everything like that. So you guys can look that over when you get a chance.
We'll ask our staff to pull that and share it after our meeting. Another question. Does the CHW movement have legislative champions supporting these goals?
Yes. This is something that we have been, Ashley and I specifically have been very busy with over the summer. Gosh, Ashley, I think we talked to like several hundred legislators at the national level. And there are a couple that are really, really strongly behind this. And I will put into the chat in a minute letters that were written by, we supported bipartisan and bicameral letters from Congress to Secretary Azar, urging Secretary Azar to champion this movement. And so that was great because we really were able to identify who the champions are, because they were the Congress people who signed on to the letter. The chief kind of champions, I would say, are our home state of Senator Casey's office has been tremendous. And they were really the people who have kind of spearheaded champions, Senator Booker, Senator Smith, there's a whole number of them. On the House side, Representative Ted Deutsch from Florida has been a key champion, and they were the office that spearheaded the House version of the letter. So I think that's really critical. That's an important question, because what we're going to be looking to Michigan for is activation, be on the ready, because all of the policy goals that we put on that slide are things that we are actively working on. And the minute legislation hits, we need to write our senators and our Congress people to say, yo, this is important. This workforce has a voice. And so getting your organization ready to do that kind of outreach and that congressional outreach is going to be very critical. So I'll share those letters.
We've got about 3 more minutes and many questions. I'm gonna start from, did you mention the training for supervisors? One folk asked.
Yes, we sure did. And that's also something that's kind of baked into that technical assistance package. We start with actually helping organizations hire the right director for their CHW program. This is not just, you know, something that can get stuck under nursing or case management. Like, this is different. And so we help people hire the right directors, then hire the right supervisors for community health workers. Sometimes they come from their existing team, sometimes not, it's new recruiting. And then we train them up. We have an executive style education for the directors. It's like a 3-day intensive program. For supervisors, we have a week-long program, I believe, and they actually get to shadow and learn from experienced community health workers and managers. And then of course we have our community health worker training as well.
Thanks, Shreya. I'm sure we're not going to get to all questions, so maybe this is the last one. Shreya, can you describe how you get a CHW program or supervisor back on the right track if you see a CHW role being underutilized, co-opted, or misguided in any way?
Yeah, I think that's a really good question. Maybe it's because I'm weak or lazy, but I don't love change management. I like to build things the right way from the ground up. If you hiring, personnel, HR, that's incredibly key. If you have the opportunity to design a program in your organization such that you have the right players in place, the likelihood of you running into that situation where somebody's just not on the right track, they don't get it, they're being racist or discriminatory or subjugating to community health workers, that chance lessens dramatically. So, you know, try and set yourself up for success from the ground up. Like, don't fall into the trap of like, oh, this is just a pilot program and we're just going to do this with grant funding and then we'll fix it later. Like, build it right the first time, because you're going to set yourself up for these kinds of issues. When you have an issue like that, the most important thing is to try to, you know, build an alliance. And so at Penn, we have, our center is kind of standalone in that community health workers are embedded in different, you know, environments, whether they're clinics or, you know, hospitals, or maybe, you know, in some cases we might even be partnering with like city jails or something like that. But they all kind of have a professional home in the center. Their supervision comes from that center. The director is in that center. And so if anything gets janky in their clinical environment, they can kind of come back home and say, I need somebody to advocate for me. And then we kind of go to it. And you all have that at home with MiCHWA, yeah.
Thank you. So this is awesome. There are a number of questions that we have in the chat that we're unable to get answered. So we'll make sure that we reach out to Shreya after the meeting and get you answers and share those back later. So we are right at 10:45, perfect time for a 15-minute break. When you return, we'll break up into breakout sessions based off of the session you chose when you registered for the meeting. So we'll see you back here in maybe 12 minutes or so in preparation for our breakout sessions. Thank you to our keynote speakers, Shreya and Ashley. We appreciate you, and we'll reach back out to you with further information.
Okay. Bye, everybody.
Bye, thank you.
Hi, everybody. If you can hear me coming back to your screen, if you want to come back, we've got about 5 more minutes, and then we're going to break and go into our breakout sessions. Hi, everybody. I'm getting a couple questions coming through. There are not separate links for the breakout sessions. I'm going to open up the rooms in a little bit so that you will automatically be assigned and placed into the meeting in which you registered for. Going to open up the rooms here shortly and folks can join. Again, thank you to our keynote speakers for that wonderful presentation. Ryan, I don't think I have that control, but that's a good idea. I've got the agenda up here just so you can see. Oh, in the next 2 minutes, we're going to go into our breakout sessions. We'll be there for an hour. Your speaker will likely speak for about 45 minutes. Then you'll have maybe 15 minutes or so for questions. And then we will break right after your breakout sessions end. Go to lunch. We'll still be here and we'll resume at 12:30 in the general session after we have conducted and participated in our breakout sessions. If you have any questions, feel free to continue to put them in the chat. Our staff and I are trying to make sure we're answering those questions as you have them. So feel free to continue to reach out to us. Before we break, I'm going to resume my screen and just highlight a little bit of our information from our keynote speakers. So Advocacy 101, we'll hear from Jen Anderson, no longer with MPCA, but she will be able to talk about Advocacy 101 and what we need and what we can do in the midst of the pandemic. Another session that you'll participate in is Training and Recruiting the Growing CHW Workforce. This is from our partners in Minnesota. The Minnesota CHW Alliance will talk through training and growing and recruiting the growing CHW workforce. Thank you for your time. One of my favorite people, Ms. Felicia and Shannon Lieski, will be moderating the CHW networking session here shortly. So I welcome and look forward to that session. Here's a little bit of information about Shannon. Your moderators will do a brief introduction, but I just wanted to highlight everyone and thank them openly for your time, treasures, and talent. And our Tina here for cultural competence and implicit bias. And then we've got Debbie Itapolo talking about the impact and utilization of CHWs in multidisciplinary teams. So what I just did was opened the breakout session. There are a number of people who are unassigned. Looks like you have, I'm going to need to do some work here to assign our breakout sessions. So if you could just give me some grace as we try and make sure folks are where they belong, or you can pick a room because somehow the assignments did not necessarily work. So you should all be moving into your breakout sessions. Ladies, help me assign if you can see it.
Hey, Janae, Shannon, can you assign me to our room?
I'm looking for you, sure. Where are you? I don't see you.
I got added into another speaker session.
Okay, I don't see your name, Shannon.
Interesting. I can see me.
You're under Lieski.
It says Shannon Lieski under my photo.
I don't know if I can do it this way.
Janae, it seems like a lot of us don't know how to get into the rooms. This is Gloria.
I'm trying, Gloria. I did
Okay.
pre-assignment based on email addresses and it did not take. So I'm literally having to assign one by one, which is an unexpected.
Oh, boy.
Technical.
Okay.
I think, Gloria, yours might be available at the bottom. So at the bottom of my screen next to like my chat option, it says breakout rooms. Mine just has me assigned in a different one than what I need.
Breakout room.
Yeah, I can't get in the room also. This is Bomani Gray.
Yes. Well, look, technical difficulties, Bomani. I'm trying. But I'm
No
sending
problem,
you
my
now
sister.
to,
Do the best you can.
you know, this is bad right now though. Shannon, I hear you and I'm trying to find you and put you where you belong.
I'll try logging off and coming back on. It might show my name differently to you.
Give me a second. What session were you in before?
The CHW, it has me assigned to CHW use and teams. Need to be in the making connections one.
Okay, move to.
Janae, could
I
you
just-
put me in advocacy?
Yes, I will. One sec.
From, yeah,
Yeah.
I know you're working on it.
There's missing a room. Okay, Ryan, I hear you. Trying to get Shannon where she belongs.
Hey, this is Bernadine Martin. I'm supposed to be in Advocacy 101 when you get a moment.
Hi, Bernadine. Can you give me a favor? Give me a second. We have some major technical difficulties that I did not anticipate, which is the pre-assignments didn't work. So I'm trying to get at least the co-chairs and the speakers in the correct room. So just give me
Okay,
grace.
I'm waiting. I ain't
The
going
hands up
nowhere.
that.
Thank you.
Hi, Janae. I know that you're working. My name is Consuelo, and I was supposed to be in the advocacy group too. So when you get a moment, if you could put me in a breakout room, please.
Sure, please put that in the chat and I can get you where you belong.
Okay, thank you.
Okay.
And Kalisa put her stuff in the chat, but I done forgot which rooms I'm supposed to be in. I don't know.
You said I'm supposed to be community perspective. Join breakout room. That's the wrong breakout room. Okay.
Janae, is there something I can do to help?
Jen, I don't know if you can see breakout rooms in progress.
No, I tried. I can't actually.
Assignment, I don't think you can help. I think this is an unfortunate, unforeseen mess.
Well, I know Ms. Felicia, I was in that breakout session for a moment and she's going forward. It's all good there.
Well,
Although
I think
Shannon didn't make it in there yet.
Shannon just got into where she belongs. I'm trying to get the speakers in there first.
Yeah, okay.
But this is an epic fail. Jen, can you ask our staff if all of the speakers have made it to their right appropriate place, please?
Janae? Yes, I sure will. Be right back.
Okay, thank you.
Janae, this is Artina. I'm not in the.
Hi, Artina.
Hi, how are you?
Line, I'm not in the group any chat yet.
Artina, you're not where you're supposed to be?
No, ma'am. I got assigned to the wrong room.
Got you. I fixed it.
Okay.
Janae, I'm still not in.
Oh, geez, Ryan.
That's okay. You're doing good. Don't worry.
Yeah, just breathe.
No, this is a
This is how it
mess.
happens.
I'm not okay with this.
Of course you're not, but just breathe. It's gonna be all right.
There you go.
That's
Yeah,
right,
it's
that's
going,
right.
it's going,
We
it's
all
going to work
got you.
out. We
That's
got you.
right.
We got you.
This is our
We
new
got-
normal. Take your
That's
time.
right.
Yes,
All at
indeed. Yes,
home.
indeed.
Unexpected.
We
And
definitely,
Martina, you're still not where you
Uh-huh.
belong.
You
Exactly.
forgot?
we got you.
No.
We got you.
I'm
We
trying
got
to
you.
work.
Huh?
I'm trying to put you where you belong. I don't know why I didn't go. Mm-mm-mm. I don't know what happened.
It's called
Artina.
life, Janae. It's okay. It's just called life. We'll be okay.
Hey.
Joe, you're right.
So you might have to reassign me because I actually went into another room.
I thought I just did, but I'm trying to find you again. Where were
Okay.
you originally?
I went in with Miss Felicia. I don't know what session that is, but
Yeah, that's networking. Okay.
I was in the CHW perspectives, Janae, if that helps
Okay,
you.
Ryan. You're next once I get Artina where she
You got it.
belongs.
Get Artina going.
And then find a place for Debbie.
Debbie, you're not in the right place?
No.
Okay, I just sent you. You should be gone.
And I need to be with Debbie. It's Gloria.
Okay, Gloria. Done. I'm still looking for Artina.
and don't forget
Cindy and Shandy need to be placed in their room for speaking when you have a chance.
Hey, Janae, it's Nicole. I don't have the option to go to my correct room.
I'm trying, Nicole.
I know.
Hey, Janae, this is Adriana. I know that I'm one of the people who didn't get placed in the room neither.
I'm working on it.
Thank you. That's okay. Take your time.
I'm really first trying to start with our speakers and making sure they're there, and it's taking me, I cannot search through this, so it's not normal.
Yeah, I got assigned to the wrong room.
Who is the male speaking?
Mike.
Mike Anderson. Yeah. I was supposed to be advocacy one-on-one. That's what I chose.
Yeah, me too. But maybe we should put it in the chat so she don't have to search. Would that help, Janae?
Yes. Yes, thank you.
Mm-hmm.
I did.
But she's searching through it, so let's do it again so she could put us in.
Okay.
She has to assign all 300 people that were here one by one, so.
Oh.
Yeah, it's a lot. It's
And it's still 100 people to go, so that's why it's taking so long, but it'll get there eventually, but it is very tedious. I've had to do it before, and she got to do it
Thank
one
you
by
for
one.
whoever is speaking for me. You understand?
Courtney.
It's Courtney, and I do it all
As
the time,
Courtney,
so I get it.
she has experience at these kinds of things.
Janae, are all the sessions recorded? Are they being recorded?
They should be if the moderator, our staff got to the right place. Yes, ma'am.
Okay, so if mine is recorded, I'll be okay. You can make Melody last. I'm okay as long as it's recorded.
Okay, I'm just sorry about this.
No, it happens.
Oh, it's okay.
This is a whole new world. We are 7 months old in this? Come on. We don't know.
Oh my gosh.
Don't stress, Janae. This is amazing. This is an amazing session or annual
Yeah,
meeting.
Janae, it's incredible what we're already accomplishing
Ryan,
today.
why can I hear you?
You can't hear me?
No, I'm saying, why can I hear Ryan? He's a
There we-
speaker that should.
Oh yeah, he's right here. I see him too.
Oh, that's not good.
Well, Ryan, tell us what you're going to talk about. How about that? Oh, Ryan.
That's another thing, Janae. If you have
he's
other
gone now.
speakers in the waiting room, maybe you can elevate them and move them into the breakout sessions.
Yes, thanks, Becky. I tried to.
I wish we could help you. I wish it was something.
So who else is here that's a speaker that can just speak to the waiting room?
Yeah.
Oh, wait.
Am I my speaker? Really? Well, I'm talking about cultural competence and implicit bias.
Okay, please. Yes, let's go.
Among CHWs, and my goal is to make sure they understand the difference between, if I have time, I'm gonna do equity versus equality, but the other things are how stereotypes work, how they come to be, and how they are so, problematic to health outcomes, and what we can do about that. And we're going to talk a little bit about making sure they got some proper definitions, and we're going to open up. I got a couple of activities for them, and what, the whole thing, the one thing I always want to make sure I do is leave them with what they can do, so they can have some kind of assignment when they get done.
Awesome.
Yes.
Well, Melody's, I'm with you. So when you go, Artina, I'll tag along.
Me too.
I'm in your class.
Okay,
Me
so
too.
everybody, can you hear me?
Yes.
Yes. Janae, I'm back.
Okay, I'm going to close the not-functional breakout sessions. And what we're going to move to do is ask each speaker to spend 10 minutes, because we're going to have to do all of them in this hour. Each speaker to spend 10 minutes about what they would have said or what they were going to talk about.
Awesome.
And then we will then later reach back out, we'll record your sessions, and we will share this with everyone who registered and attempted to attend.
Right,
Amazing.
sis, move with the punches.
Pat yourself on the back, Janae.
Improvise.
Good critical thinking.
All right.
Yeah, I just returned.
Okay.
That's what community health workers do.
That's for sure.
Adapt.
Yeah.
That's right. Flexible and adaptable.
Yeah,
I'm gonna ask
absolutely.
themselves, please, just so I can, I'm gonna talk for maybe 2 minutes, and then we're gonna ask people to get our sessions going. So I apologize greatly for
Not your fault.
this organization and Zoom not accepting my pre-assignment. So what we're gonna have to do now is pivot, and I'm asked each of the speakers maybe to just unmute themselves and spend maybe 10, 12 minutes most about your session. So I'm gonna go offhand in order from what I can remember our agenda to be. The first session was going to be Advocacy 101 from Jen Anderson. Jen, if you're here, please unmute yourself and just give us a 10 to 12 minute overview of what CHWs can do in the midst of the pandemic as it relates to advocacy.
Okay, are we actually going to be doing the breakout sessions, or what's going on?
No, Jen, so Zoom is asking me to assign one by one, and it's just not gonna make it in our session that we have. So I'm asking for grace and adapting to the agenda and our technical difficulties to just each breakout session speaker give a high level 10 to 12 minute overview, and we'll reach back out later to provide a full session.
Sure, great. Well, my name is Jen Anderson. I am the Senior Communications Officer for the Delta Dental Foundation, and I'm formerly with the Michigan Primary Care Association, which is maybe how you know me, because I worked with our federally qualified health centers throughout the state. Part of our presentation, I'm also Ryan Grinnell Ackerman, who you probably know, was also going to be presenting with me and talking a little bit about the actual legislative process. Hey, Omar, see you on here in that chat. But really what we wanted to talk about was the fact that advocacy starts with you, and that your elected officials are beholden to you. And it's not just your elected officials, right? Policy can happen at the administrative level. So that means MDHHS, that means LARA, that means all of these other state agencies and bureaucrats. And that part of, oh, there we go, sure. Here, let me, we can flip forward a couple here. Yeah, we can go through all this. Keep going. So here's, I mean, Ryan was going to talk a little bit about this, but basically, laws get made. We can, if you really want to know, if you do the how a bill becomes a law. If you Google it, it's pretty fun. You know, you can get that whole great little animated video. But the regulatory process is also a way that we can be advocates, and that's when a regulatory agency, like such as a State Department, puts something out for public comment, and then there's a period of time for you and for basically anybody who wants to provide a comment on that. And that's usually a really good opportunity to write a letter and say, hey, like this is how I agree with this. This is why I don't. This is why, you know, this is the actual impact of it. And then the State Department will close comments and evaluate that, decide what's going on, whether these comments are, you know, they think they're valid. They will reevaluate, and then they will post their final policy, and that hopefully they actually took that that information into account. Could you advance the slide? We'll have to go quickly. Again, know your
Yeah,
policy.
one of the things that I would just add real quickly, though, is that, you know, I think oftentimes folks focus into, you know, that the legislative process is more where, you know, anyone can bring an idea to a elected official to, you know, start the problem. But, you know, really the work that Janae's doing with MiCHWA is doing the same thing on that regulatory side as well. So, you know, we're taking ideas, you know, the organization MiCHWA is taking ideas to, you know, folks at the state and working through this regulatory process as well in an attempt to really, you know, shift what administrative policy looks like for the state and how that can support CHWs.
Yeah, and part of this really knows this, you know, part of what we talk about a lot is just knowing who you're talking to. And we just put some people up here as an example, like somebody who's a policymaker is, you know, the director of the Michigan Department of Health and Human Services. And also we put Senator Kurt Vanderwall and Representative Hank Vappel, because all of these people are people who have are deeply involved with health policy committees, and they are the chairs of their committees. So it's really helpful to know who's helping make and set policy in the state. And you need to know, like, what are your elected officials' leadership roles? You know, what are their pet policies? You know, although both of these people obviously have their own issues, you can bet that they have an outsized role in determining if and when legislation related to healthcare happens in this state. So you really need to know who you're talking to, so that way you can actually make sure you're being the best possible advocate. You can move forward. By that same token, whenever you're getting ready for your meeting or your call or your letter or even your social media message, which advocacy is all of those things, you want to make sure that whatever your message is, it's taking your audience in mind, right? So the way that maybe I would talk to Senator Shirkey is not the same way that I would talk to Senator Ananek. They both have very different priorities, and they both appreciate different kinds of framework. So if I'm talking to Senator Shirkey, I might frame my message around freedom, the way that, you know, for example, CHWs save money in the healthcare system. I would talk about jobs. I would talk about family values. And then, of course, constituent needs are important no matter who you're talking to. By that same token, if you're talking to a Democrat, maybe you're going to talk about strengthening the safety net. You're going to talk about social equity. You're going to talk about racial justice. These are all things that maybe are going to appeal to, you know, to somebody who tends to be a Democrat. Again, these are generalizations, so everybody's different. But you have to keep these things in mind, because if you go at, you know, Senator Shirkey talking about racial equity, he's probably not going to respond as strongly as maybe somebody else would. You can keep going. Again, people listen to you because you're a constituent. You're an expert in your field. You know what you're doing. You know your patients. You can help deliver a win. So these are all really important things to remember, is that you are giving them a gift. You are giving them a way to win with their constituents, which is incredibly important. Sorry, I know I'm going really fast. We can keep going. What's really important, though, is no matter what you're doing, whether you are whether you're sending a letter, whether you're organizing a virtual event, because again, a lot of the times we talk about Hill Days, we talk about these big in-person things where you're storming offices and you're really making yourselves visible. Now we need to do that in a space that's virtual. And I've met with a ton of different elected officials recently, and we've done this all via Zoom, on conference calls. There's lots of different ways you can still do it. So, you know, what you need to do is identify your problem, define a specific solution, translate that into action, you know, create materials for it, and then, you know, pitch your solution to elected officials. You can keep going. Really, here's a really good example, though. So if your problem is long-term sustainable funding for CHWs, you know, your solution is direct payment. Here's the action, the very specific action. Again, we can go over this another time. And then your message would be like, how do you craft that message around it? You want to make sure that you're offering a win, you're offering a solution. You can keep going. So again, we talk a lot about opportunity. So you're giving an elected official or any other policymaker an opportunity to do something good for their constituents. You know, you're doing something that is maybe not a really big deal from a budgeting perspective overall, but will have a huge impact on the people in their constituency. So that's actually really important. I think I only have like a minute left, so I guess we'll just keep going a little bit. Just keep going. We can still keep going. The one thing I want to leave you with is that there's a lot going on right now. And again, you know, I'd like to talk about this in more detail, but we are all overwhelmed. And I think that we all need to be very honest with ourselves as advocates, where we are, who we are, and what we need. And burnout is a real thing. You can just flip forward to the next one. And, you know, you really need to pick your battles. You need to make sure that, you know, you're not asking too much of yourself and others. You know, this is something that was a really big deal for health centers earlier in the year. There was a point where I just couldn't ask anybody to do anything else because it was too much. It was just, there was so much going on in their professional lives and their personal lives that we just couldn't move forward. So you need to be honest about your capacity and encourage very small steps. And if you're working with a big group of people, please make sure that you're creating tools. Work together on this so that you all have the same resources and you have tools and templates so that there's, you know, you don't have to expend too much effort to make your case. So that's probably all the time I have. And I know that was a big rush, but thank you very much for your time.
Thanks, Jim, for your grace. Folks, if you have questions, feel free to send them in the chat. I'm just going to prepare that the next presentation you'll hear from is cultural competence and implicit bias from Martina Sadler, and Nia is going to drive, and you can see her screen.
Hi, everybody. My name is Artina Sadler. I am officially the Chief of Diversity, Equity, and Inclusion for the Huron-Clinton Metro Parks, but I'm also a lecturer at the University of Michigan Flint, where I've been teaching cultural competence in healthcare for about 15 years. We're going to talk about, you have to excuse my slide being a little off, but I was editing and I forgot to edit this one. So we're going to talk a little bit about cultural competence, and I'm going to use some definitions. So go to the next slide, Nia, please. Thank you. So cultural competence for us, there's a lot of different definitions, but for us and for community health workers and people who work in healthcare, would be, the definition we would use is the ability to successfully interact with individuals who come from cultures different from our own. It entails developing certain personal and interpersonal awareness and sensitivities, developing certain bodies of cultural knowledge, and mastering a set of skills that taken together bring about effective cross-cultural teaching. So, and you kind of counter that with, compare that to diversity, which is the sum of the ways that people are both alike and different. Hopefully, but through this definition, you can see that cultural competence is a lot more involved than is diversity. And you can see that we need more cultural competence versus diversity in our healthcare system, including with our CHWs. Next slide, please. You know, we have a few, and I'm going really fast because I actually want y'all to do an activity real quick. So we see the difference between the definitions. We like to use things interchangeably in society, and I would encourage you not to do that. When we talk about the similarities of diversity and cultural competence, we're looking at, they both recognize people as human and therefore different, and both have important implications for health. The difference is cultural competence requires you to examine what difference means in real and concrete ways. It requires you to go beyond diversity and better relate to other cultures, and cultural competence is all about you. So when we talk about the real ways in which these happen, we have to talk about how we came to be in this space. How did it come to be a difference between different cultures, different races, different groups? Where did these differences come from? So next slide, please. Rationale quick, you know, we're more diverse than ever. And now in the current social climate, cultural competence is super, super important because COVID has really exposed many of those systemic inequities that we've been dealing with for so long. I always laugh when I hear people say that, because it's like, I knew this a long time ago. Most people of color knew all this stuff a long time ago. It's just becoming more evident to white people. So, you know, that means that we really, really need to understand cultural competence. Let me see. Culture plays a critical role in health. You all know that, I'm sure. Cultural competence leads to better health outcomes. I hope you know that. Cultural competence practitioners are better equipped to reach out and interact with patients' families. This is where our community health workers is really, really important that they are culturally competent before they go into somebody else's environment. And cultural competence help providers meet accountability requirements. I'm going to go back to number 4 real quick. One of the things that happens a lot is that we get people together. I really appreciate the keynote when she talked about training and stuff like that. We send people out into these environments and they're not personally prepared to handle what they're going to see. They're not personally comfortable working with people who are different. And so that's one thing you should never do, right? Every community health worker needs to be culturally competent before they walk into any other environment, because they can do more harm than good. So we want to make sure we're always looking to make sure that people are properly trained in those areas, not just the health stuff and all that kind of stuff, but they really need to understand how culture works and how to pull themselves back, because cultural competence is all about you, right? That's the other difference between cultural competence and diversity. Diversity is about, oh, well, we're all different, so let's just get along. But cultural competence requires that you challenge yourself to ask yourself, why are we different? What does that mean? How do I navigate that space? So really getting that training for our healthcare workers is going to be super important. Next slide. So the question is always, how do we get there? Okay, next slide, please. So this is my favorite quote, and it's by W. Edwards Deming, and it's, every system is perfectly designed to produce what it produces. And Mr. Demings was, or Dr. Demings, he was an engineer. And so you're probably wondering, why in the world would you use an engineer's quote in a community health workers conference? Well, the thing is that the thing about cultural competence that we have to remember is that everything we see is not happenstance. This stuff didn't happen. The inequities we are seeing exposed through COVID, they are not by accident. You are seeing the results of a perfectly functioning system. Everything you see is what is designed to be seen and designed to happen. So one of the things we have to kind of debunk is that whole idea about, well, you know, we just have these disparities. We don't just have anything. Those disparities are baked into our society. They're baked into our community. They're baked into our healthcare system. So understanding that is one of those key components of cultural competence that we really need to get our arms around. Next slide. All right, so stereotypes. Stereotypes this is like the entrance into this whole process. And stereotypes are one of the key ways in which health inequities continue. So I don't know if we can do this or not. Nia, I don't know if we can do this or not, if we can do a quick poll, but I would ask you to think about stereotypes. Can we do a poll, Nia?
I don't know if we can do it. I don't think we can do a poll, but maybe people can just put it in the chat.
Okay, so I want you to think about stereotypes. Okay, so if you could think about a stereotype for African American, and just put it in the chat. Think about a stereotype for a white person, a person who is Asian, a person who is Arab or Middle Eastern, a person who is poor, a person who is rich. If you can think about those kind of stereotypes, you know, the images we have, and if I can give you some, because I've been doing this a long time and I've heard them all. I mean, not all of them, but I've heard some good ones, right? So Black people are dangerous. Black people are, they're not educated. Yep, they're violent. Thank you. They are, you know, they have all these baby daddies and, you know, some other kind of stuff. Latinos are gang members. They are illegal immigrants. They are lazy. We have white people. White people are educated. They are wealthy. They are all Trump supporters. They are, you know, things of that nature. They are racist. Who's aggressive? So Arabs, people who are Arab, they are terrorists. They are aggressive. They mistreat their women. All these kind of things really, really impact and influence how we see the world. But the question is, where do these things come from? Because they, again, are part of this system. Where do they come from? Next slide, please. So this is our cycle.
About
Yes.
2 minutes.
Huh?
About 2 minutes left.
Okay, all right. So this is our cycle of conditioned behavior. And what we do with this is we talk about how things are created. So over in the corner, right by the groups are prepared, we would start asking you, where did this stuff come from? And we usually get these things from our family, from our community, from the media, from our faith institutions, from our schools. We get these stereotypes from those kind of places. And what happens is everybody gets the same information, right? So there's no every stereotype I've ever heard I've known about me being Black, I've heard it before. I've heard it from my own people. So we all get the same kind of information. And what happens is that what we do is that information kind of filters how we see everything, right? So if Black women, the stereotype about Black women is that we're loud. If I'm being loud, we assume that is a Black characteristic versus just me being loud, right? Because I'm loud. And then we use that information to reinforce stereotypes and reinforce those behaviors. And then we put it back into the preparation for the next group. So it keeps going around and around until we can manage to kind of interrupt that. Next slide, please. Next slide. So what can we do about this? Next slide. So this is the final one. So what I say is go back, Nia. I said, what we can do about this, we can get real, right? So we can recognize that you and I are part of a system that produces poor health outcomes. We have to understand how we contribute into that system, and in understanding that is critical to changing it. We have to educate ourselves. And the first step is do what you're doing now. Attend these kind of conferences. You need to learn history. And I mean real history, right? Learn how we got where we are. And you have to keep in mind, if you're in training and you're comfortable, you're not learning anything. The act, so you want to act on what you learn. You want to ask questions. You want to seek real answers and not be comfortable with the status quo. And you want to love people. You want to care about the outcome and care about them. I'm done. Thank you.
Thank you so much, Artina, and thank you all for hanging in there. If you would continue to just add your questions to the chat, we'll be sure to get those to our speakers. We'll share our slides. And I just want to introduce Debbie Itapolo, and she's going to be moderated and facilitated by Jen from the Ingham County Health Department to talk about impact and utilization of CHWs with other professions and health services.
Thank you. Hello, I'm Debbie Otapolo, and I am the Deputy Health Officer with Ingham County Health Department. And I'm going to run here quickly. I would just first like to say that, we have some really great definitions about the role of community health workers. And I think that our keynote speaker really did an excellent job at talking about where I felt like I was going to try to get to. And we often talk about community health workers in their role around being trusted community members, and that they are a bridge, they connect. And particularly we talk about healthcare services. And I think that is one of the things that, excuse me, my voice is trying to leave me. That is one of the things that we often equate CHWs with. We know that they're good with chronic conditions. We know that they're good at helping with parent education, infant mortality, bringing down infant mortality rates. One of the definitions that I want to go through, can you change the slide, please, Jen? One more time. One more. Yes, one more time. Keep going. Stop. So go back. So when we think about, for me, I've really found this definition to be a good definition, because in it, a couple things I want to highlight is that CHWs, they advocate for change. They improve access to the quality of care and cultural competence service delivery, how service is delivered. Go down, next slide. Keep going. One more. So what I want to talk about is that health is defined, I define health broadly. And so we often think about health in terms of, do we eat healthy food? Do we get enough exercise, enough sleep? And do we go to the doctors on a regular basis? Next slide. But I say that health, an example, is also about where we live. Do we have walkable streets? Next slide. What does our downtown look like, or what does our business district look like? Next slide. It also is defined by the behaviors of others in our community. Is there gun violence? Do we have paths to be able to ride our bicycles? Next slide. What does our structure, our housing look like? These are all the things that CHWs deal with on a regular basis. Next slide. So when we talk about the impact on the utilizations of community health workers, they have a lot to have to deal with. And health, when you define it broadly, you recognize that it encompasses dealing with people about where they live. Next slide. So these are the CHWs at Ingham County Health Department. We hired between 23 and 25 CHWs and in a variety of different roles. Next slide. And some of the things that they work on are chronic disease, infectious disease, early childhood intervention. But things that are key to me that I feel like we have not had opportunities to work on as much are around environmental justice, health equity, and social justice. Next slide. And something that I feel strongly that community health workers are the ones to be utilized and have the greatest impact on are managing those social determinants of health. And social determinants of health are those issues related to where people live, their housing, access to food, employment. And CHWs provide the context to the other team members who they are working with as the whole picture of a patient's life or the client's life. They are the experts because oftentimes our community health workers live in those same places. They have some of the same experiences as those that they're working with. And so they can help to put things in a way that providers can understand. An example of assisting a patient in dealing with non-medical issues, we had a gentleman who he was a diabetic, he was homeless, he went to his doctor, the doctor gave him a prescription for insulin that needed to be refrigerated. And so, and this is kept going over and over. He'd go back, where's your insulin? I don't have it. I'm homeless. And the doctor never got it. And so it was the community health worker who could say, he's homeless. He doesn't have a place to live. So insulin that needs to be refrigerated is not a good idea. And so sometimes they can speak to the things that normal people or physicians, they're not even thinking about. They're really good at mobilizing the community. We oftentimes ask a community, can you get a couple of people? And they get like 20. So they're really good at that. Next slide. I like this picture because it really talks about, they are really about the whole family and everybody, and they become a part of the family. Next slide. So I really highlight these are some of the things that they do well. Next slide. And then these are some things I want us to consider. Do we allow our community health workers to present their authentic selves to work? We in the workplace, we often have, do you have this? Do you do this? Do you look like this? And really allow them. Do we provide clear expectations and outcomes of what we hope to happen? Provide them with trauma-informed supervision. I say that when you are a person of color, oftentimes we are traumatized by racism and the things that we deal with in our regular life. And so having that is helpful. Providing a living wage or more than a living wage. I love what our keynote speaker talked about, having Medicaid be able to help. And I agree with that because I do believe that we need to provide qualitative and quantitative data. I believe it is sort of the dominant culture that says that everything, all of our data has to be objective. And I say that we need to push back and we need data that tells stories so that there is something different because not everybody values just the qualitative data, but we need to build the infrastructure for our Medicaid reimbursement. And then I talk about ban the box. And I know you're probably saying ban the box. Hasn't everybody banned the box? I don't know, but we need to make sure so that we allow people who have been arrested or been in prison an opportunity to have these jobs because they also are part of those communities or our communities. And I will say that if you live in a community of color, you're probably 20 times, one study says there are about 20% have been some police contact. And so there's more opportunities for us to have had contact with the police and may have a record. We need site mentors to help our community health workers to fit in and to feel really a part. Next slide. And then when I talk about community health workers with a multidisciplinary team, we need to provide role clarification, remove the hierarchies, make space for CHW to share vocabulary and to share about their communities and help to teach others about what's happening. We need to provide team building so that there isn't sort of this dissension within the team because the community health worker doesn't look like, doesn't sound like what some of our other folks want them to. Next slide. And then what I didn't talk about, I really want to just highlight the role of CHWs. They educate healthcare providers, stakeholders about community health needs, meaning that it's not just the community health worker taking something out, but they're providing true education to the providers, those who have been what we call the educated ones. They provide culturally appropriate health education. They do that, yes. They advocate for underserved individual communities to receive services and resources to address health needs. The keynote speaker talked about community health workers helping with policy. And really, I think that that's important, and having a seat at the table and a voice that's heard. They collect data and relay information to stakeholders to inform programs. Oftentimes programs and policies are being made without them, but yet they have, they're on the ground and they are also in the community and they're in the organizations, and they need to be included when we make decisions. And we need to build capacity to address health issues, but also address social determinants of health as well. Next slide. And we need community conveners so that when our CHWs lift up issues, we have a place to take those issues to where there's someone who can start some action to make some change. Community health workers oftentimes bring up issues, but there's never an opportunity. They can't do it. They often don't have the power. We need community conveners that have community health workers. It's neutral. There's agency folks, there's community members, and then there's elected officials that can make some of the changes that we need. I believe that community health workers, and that's what's embedded in that role, is community organizing as well. Next slide.
Just about 2 minutes, Debbie.
We are in a different cultural times. And our community health workers are the most to speak to what's happening because they see it and they know it. And I think we need to value it, we need to pay for it, and we need to allow them to do what they do best. And I will just say, next slide, myself, I started as a community health worker over 30 years ago, and we all have the opportunity to speak for our communities and to do what we need to do. And so that's it. Thank you.
Thank you, Debbie. As Jen stops sharing, I'm just going to poke Nicole to bring up our CHW networking session slides and introduce Felicia Lane and CHW over 28 years from Henry Ford Health System, and Shannon Lieski, one of our great training partners, to present a high-level overview of what they would have talked about at the CHW networking session. Nicole, do you have their slides? Shannon, do you want to unmute yourself and just start talking as she does so?
Yeah, that, or I can pull up mine. I can share my screen.
Have that.
All right, so thank you, everybody, and thank you for the great introduction. So in many of my roles, I'm also a CHW. Like Miss Felicia, not as much experience, but just about 20 years now in various fields of work. And so just, it's really at the center and heart of what each of us do. And so we came together collectively, not only to tell you kind of some high level basics of networking and how to build networks, but also around who we are as CHWs and how we network and find value in it in our career pathways. So at a high level, you know, a network, how we're going to define it is essentially a group. It's a system of interaction of people pretty much sharing common interest and exchange of information. There's 3 types overall, so operational, personal, strategic. Some of the big differences is operational is often within your own organization. Personal is going to be more outside your organization, and then strategic is going to be the one that we're going to center around most today, and that's around supporting and enlisting people that maybe have knowledge that you don't have. And so when we do our work as community health workers, this is something we do most often, right? If we're assisting a patient or a client, an individual who has barriers in an area that's outside of our scope, we're going to find that person. We're going to use our navigation skills, our motivational interviewing to do that work. Some of our questions I'm going to hold and get to at the end with our picture, but kind of food for thought. How do you build your network? Start to think about that from many different perspectives. Us as human beings are constantly building our networks, whether they're with our social systems, our families, in our professional life. We're building connections with one another. Going back to our kind of strategic networking, there's 3 focuses that you want to center around. One is building that relationship. In order to have a great network and an authentic network, you're going to have to build those connections and relationships with one another. A lot of that involves in getting to know somebody, maybe opening yourself up, but also opening your ears and listening to that person. Similar to the work that we do as CHWs, we're doing it with one another. And then branching into the unknown. You know, as the previous speaker talked about, sometimes get a little uncomfortable to learn more and to get connected. And often ask, how can I help? Don't be in it for yourself, be in it for others as well, knowing that you have something to share with that relationship. One of the great quotes that I love about networking is knowing that no man is on an island. Although during COVID in 2020, some of us might have definitely felt like we were more alone than we've been before because we were at home or in offices that had a lot less person-to-person relationship, which is at the heart of what we do, right? As CHWs, we are people interactors, you know, we want to be around others. And so recognizing you're not in this alone, and that's one of the great benefits of the networking. The other question that I want you to consider in food for thought is, why do you network? Think of the value of that network and what it's brought to your life. Some key benefits that I've seen and that I hear from others in networks that I've helped build are around shared experiences, maybe job hunting, training opportunities, empowering and supporting one another. This is tough work. So a lot of times what we're doing is just supporting and maybe validating the work that's being done. Being a shoulder for somebody is not uncommon. Learning and understanding one another. So again, my perspectives as a rural CHW have some similarities, but they also have some differences to the work that like Felicia does, for example. And so we lean on one another and we want to learn from one another on how we can support or share information. Get connected is really going to be our theme. Get connected somewhere, get connected with multiple networks. We're going to share a little bit about, and I know Janae's team will give you information. If you're not connected, at a bare minimum, get connected with MiCHWA's network. It's a great way to meet CHWs. They meet regularly. It's a wonderful group of individuals. So our closing slide is really what we wanted to spend the majority of the time on. And then again, share kind of our experiences as CHWs. So Felicia is going to talk about this slide, share her experiences and networking and the value of it. I'll share a little bit of mine and then we'll close you out. Go ahead, Felicia.
Excellent. Hello. Hi. Can you hear me? Mm-hmm. Okay. I don't know if everyone can see me though, but I'm just going to go right on with the presentation. Thank you very, very much, Ms. Shannon. Us as community health workers, have you ever heard the statement, being in the right place at the right time? That's what networking is about. Community health workers giving us an opportunity to meet people that can help us with our program or that can help us serve our community. Everybody has that networking skill inside of you, but you have to find that one that fits you. It's not like a one size fit all. Everybody had that specialty within inside of you. Now, for me, I like to what they call work the room. So when I go in there, I get to talking to everybody and introducing myself. But some of my coworkers, they might have a small setting that they're comfortable with. But what you do is you find what's comfortable with you and you work through that. Making a connection, like we say, opportunity. We meet and recruit for our programs. We meet people that can help us with our programs. I used to always say, okay, when I talk to people and everything, they would say, oh, wow, is that what you do? Oh, yeah. I tell you what, I was looking for someone to donate some diapers to and some bibs and some bottles. And I was like, okay, cool. But I wouldn't have had that opportunity if I wasn't networking with the people. And then also benefits. You build relationships. We build relationships, long-term relationships with the people that we meet. We exchange our experience. And I mean, to this day, the relationship I met 20 years ago, do you know, I still have that relationship with them today. Also, have you ever heard, it's not what you know, it's who you know. That's what networking gives us. It's people that we meet. Because sometimes that particular person might sit on a board that you need to get some money from. And they say, you know what? We went to a meeting and I met you. You was working the room, so to speak. That is one of the good values that we as community health workers in regards to networking. I wanted to end with this picture. This is Henry Ford and George Washington Carver. And just put it in a nutshell. We are going through this journey called life together, and we need each other. You could call it networking, or you could just call it just you met somebody on the street. But the main thing is that these two people, great-minded people, came together back in 1932. They didn't see color. They saw what we can do to leave a legacy and a vision to leave for people of all colors. I had the opportunity when I was networking to meet his grandson. And I told him, I said, you know, I liked it, your grandfather. And he laughed and he said, I liked him too. And we laughed and I told him where I work. He said, hey, you one of us. Oh, you one of us. And I said, oh, that's so nice of you to think that of me. And he said, yeah. And so he said, you know, George Washington Carver was his friend. And I said, I heard. Friendship is what we meet. And they stayed friends until the day they both died. And that is what networking is all about, working together as one, not seeing no color, not seeing no race, just seeing a person for who they are. Thank you very much and allowing me and Ms. Shannon to come to you at this time.
Yeah, beautifully said. Thank you, Felicia, and all your wealth of experience. And just to add to that too, you know, Ms. Felicia and I met in my first year at MiCHWA, you know, almost 6-7 years ago now. And we've held our relationships, love seeing you at conferences, even out in Vegas, we went to the national conference. And, you know, when we were struggling locally in mid-Michigan with our flooding this spring, although we're 3 hours apart, she was the first one on the phone calling and saying, how can we help? You know, our CHW network is strong across the state. And so that's one of those things I always like to share, that you become part of a family and part of a community, and it's really important to connect with one another. Thank you, everybody.
Thank you.
Thank you, Shannon. Thank you, Ms. Felicia. I must say that this format, even though Zoom gave me lemons, might be better off for us. I'm really happy that we're able to hear from each of our speakers. Next up is going to be a colleague from the Minnesota CHW Alliance to talk about training and recruiting the growing CHW workforce.
Hi, I'm Cindy Caro, and I'm in Minnesota where it is sleeting, snowing, raining, and we just had thunder and I saw lightning all within the same probably half an hour moment. So welcome. We all got out our snow jackets real quick. So I am a faculty member at a local community college, and I am one of the education chairs for the CHW Alliance here in Minnesota. Next slide. This is just Shandy is one of our CHWs, and she may pop in. I know she was at work. So next slide. And I'm just going to go through this quickly here. Let's see. Are we in there? Do I see my slides? There we go. There we go. I just wanted to go through, there we go. You can go all the way down to the agenda, just so people can. So this is the little bit of the agenda that we created. Because we have 10 minutes, I'm gonna cruise through some of these so you can go through the next slide. This is the strategic plan right from our website. Do the next slide. Now, again, from our website. And then next slide, there we go. A little bit I want to focus on is our curriculum development. Our curriculum was originally created in the early 2000s, and it is owned by MiCHWA's, which is the college and university state system. And the reason it's owned by them is because it was funded. Someone who worked for MiCHWA's at that time was the one who got the funding and created the curriculum. It was updated in 2010 to add health promotion, because previous to that, it was just the core competencies. And I also want to add that we are in the process right now of revising the curriculum. So I want to focus on that and our registry. And also we are a academic credit-based curriculum. So I'm going to have you scroll through a couple more slides. Kind of quick, who helped us write our curriculum and are helping us again. Next slide. Next slide, what were people looking for? Here, I want to stop here. One of the reasons why ours is a credit-based academic credit certificate is, one, community health workers who were not credit-based, who had been working as CHWs prior to the curriculum, wanted it to be a credit-based. And one of the reasons is that it gave some empowerment and validity. It created a scope of practice, and there was a certificate of completion. There also is the opportunity for stackable credentials. We have many individuals who come in as come in with a certificate, and some are a community health worker, and that's their profession all the way through. Some stay a community health worker and want to add or explore different career opportunities. And so it is a stackable credential. We get a lot of individuals who, this is their first time, first generation going to college. And this is something they're very passionate about, is community outreach, education. And so some people move on to their next degree, to an associate's degree after that. Some do not, but it provides that academic credit on a transcript. And then next slide. This is where we are right now. A couple of these have changed. Summit Academy closed theirs, but we added St. Mary's University. So this is where we are across the state at this time. Next slide, please. Now, this is just a little overview of how we have to go through our curriculum. First, an individual, if a college wants to, or usually it's a community college. Some of our universities, we have 2 universities that have the certificate program as minors in a bachelor's program. The rest of us are all community or technical schools that offer it. And the unique thing about community and technical schools is that it is open access to anybody. All you need is a high school diploma or a GED. And so accessibility is much easier for at a technical and community college. Next slide, please. So this was our curriculum review process, which I really want to show you about. And then our registry is, we started in the summer of 2019 and had focus groups across all sorts of different stakeholders. We had focus groups with the health plans. We had it with CHWs, with our public health departments, with Department of Health, Minnesota Department of Health. And we had to do a lot of education on what an academic certificate looks like and our parameters for delivering the certificate and why it is a credit-based certificate. And then after the focus group information, we used money from a HRSA grant that Normandale had received in order to create a robust survey that we then sent out again to stakeholders and more stakeholders that we couldn't reach with the focus groups to gather information about what were the important topic areas that people wanted in the curriculum. Did they want to keep it a certificate? Did it want to go to an associate's degree? Did it want to be credit-based? What was the opinion? Because we were getting a lot of feedback verbally from a lot of different sources, but it was from all over the place. We needed to narrow down our responses. And the responses came back that people wanted it to be a credit-based certificate. And that was from employers and that was from CHWs who either had already taken the certificate or hadn't taken it. But that was one of the consistent messages. After the survey, then our CHW Alliance Education Committee got together and had a few outside stakeholders join in. And we started to really look at all the objectives, what was overlap, what wasn't overlap, and how do we improve it for the 2020, for the next revision. And so currently right now, we have individuals who are writing curriculum, reviewing curriculum, and from all sorts of stakeholders. And we are hoping that we'll be able to roll out to the schools to be offering fall 21, the new curriculum. Next slide, please. And this is kind of what I just talked about, overlap. Keep going. And these are some of the new courses of how it will. We have put it in as a 16 credit certificate program. It used to be where it was 11 with the health promotion. And the reason we changed it to 16 is because 16 credits is the minimum for federal financial aid. And so we wanted to make it financially accessible to students. So if they had financial aid, which majority of our students qualify for financial aid, they could use that money to pay for their certificate. If it was under 16, then students would have to take some other classes to get up to that 16. And we didn't want to do that. So we have 9 of the core competency. If you could go to the next slide. And then we have 5 credits, which is our health promotion. And those 5 credits are broken up. You know, we have a lot. These are some of the topics that are there. Some people can break it up into a 3-credit class, a 2-credit class, or a 5-credit class. And then we still have an internship, which is 2 hours or 80 hours, but 2 credits. And so that's all of these are being reviewed right now. Some information may change since it is still all in draft form, but this is where we are at this point. Next slide. We do have national exposure. Our curriculum has aligned with the C3 project, the Pathways Hub. So we take our curriculum very seriously and we are protective of it but we love that organizations in other states want to use our curriculum. So next one, please. Not going to go through this much, but we are a state that does provide reimbursement for Minnesota Care and medical assistance for CHWs. Go to the next one. I'll show you. I just put the legislation in here so you could see it. It is limiting, and that is a barrier. Couple barriers for the reason is the billing isn't, it's limiting into organizations unless you receive Medicare or medical assistance or Minnesota Care, you can't bill for a CHW. And we know a variety of organizations hire community health workers and don't bill for anything. And so one of the reasons the legislation was put in, and this was early 2000s, late 90s, was to create some validity and have it attached to healthcare. We do have a variety of safety net organizations that are working hard to expand the legislation language and the billing options. We have to work with our Department of Human Services on how to get that all in process. And so people are advocating, people are looking at it, and we're hoping we'll make movement. And one of the ways that we're hoping to make movement is, if you could go to the next slide, please, is that we are starting to develop a registry. Now, we didn't have a registry in our state before because for CHWs, because we were trying to figure out where we were going to house it. Is it through the state? Is it through us? We got some funding, and Shandy, I don't think she's on here, but Shandy is one who is developing the registry and working on how do we market it, how do we send it out, and the purpose of the registry. So if you could go next one.
Just about 2 minutes, Cindy.
Thank you so much.
Sorry.
Oh, there's Shandy.
Yeah,
Shandy, you want to talk about
sorry.
the registry? I just saw
Yeah,
it
of course. Yeah. Sorry. You're doing a great job. So you could have gone on and I would have just been following.
You do the registry.
So the registry is, we worked with MiCHWA because they've, obviously Michigan's ahead of us with their registry. And so we really partnered with a lot of states that kind of have their own type of registries in order to kind of take us off the ground. But the idea first came in 2019. There was an idea of the registry, but we weren't sure if it was going to be for only CHWs that were certified. And then there was a lot of momentum to keep it a non-certification registry. So all CHWs, whether or not they have certification, could be included on this registry. And that was by multiple stakeholders, including CHW's voice on that. And we, through partnership with other states and MiCHWA and research, we've looked at the registry being a pivotal thing for us to move the workforce forward and strengthen it. Because oftentimes we just get, officials that don't know what the number of CHWs that work, where they work, what regions they're working, and what do they do during their day-to-day work life. And this is a great opportunity where we're hoping that it's going to allow for employers and supervisors to be able to connect, CHWs to network, and also the big piece, as many of the other presenters have spoken on, is advocacy. This will be a huge win for CHWs to have a platform in which they can network and learn about ways that they can become more advocates for their clients. Yes. Go ahead, Cindy. Oh, you're on mute.
Mute, Cindy.
I'm always the mute button. Yeah, and so we're just we're moving forward. We're taking models from other states, and if you're interested in learning more, when these slides are posted up, I did hyperlink the website to our icon on the bottom left. So look forward to questions, comments at a later time. And we thank you so much for this invitation.
Thank you both. So I am just going to again say thank you to our speakers, Shandy and Cindy from Minnesota. We're going to close it up with our high-level review of our breakout sessions by really just highlighting the CHW perspectives in the midst of the pandemic. So Bomani is going to talk about what would have happened in our session.
Good morning, everyone. My name is Bomani Gray, and we want to welcome you to the 8th annual meeting of MiCHWA. I'm a CHW at the Detroit Health Department, and we just wanted to hear from the CHWs that are in the room about their perspective of the COVID-19 pandemic. First, as we go through this, since it's such a large room, please raise your hands to be unmuted to speak briefly, respect individuals and different opinions in the room. Feel free to respond via chat or respond reactions. Allow CHWs to speak first. If you're a CHW in the room, we want to hear from you. this is your opportunity to engage with everyone else in the room. So I'm just going to jump into some questions here. Because of the COVID-19 pandemic, please describe any changes to what, where, or how you deliver services, your role and or activities. That's question one.
So I'm going to chime in.
Okay, go ahead, Janine. Go ahead.
We were going to spend 15 minutes on each of these slides, and we have 15 minutes left. We're eating into your guys' lunch, so I hope you're eating now. If you want to share some feedback in the chat, feel free to, but we're going to send out these questions for you guys to be able to formally respond to. But I just wanted to have Bomani overview some of the questions so that you can think about them, and then you can respond when we share the feedback after the meeting.
Thank you for that. And so we'll move on from here. Were there any of you furloughed or laid off due to COVID-19 pandemic? And that can be yes or no. If yes, please briefly describe when you were furloughed or laid off. Did you lose benefits or were you brought back from furlough? I think I heard a voice in the back. Did someone say something or want to comment off of that? No? Okay, we'll keep it moving. Has your employer offered or arranged for you to have COVID-19 related training? And that can be yes or anything else. All right, you guys are making this easy for me. Okay.
Chat, they're there, Romani. They're
Oh, I
sharing in
see.
the
Yeah, I
chat.
see them down there. Yes. Okay. Sorry. Okay. No. All right. All right. What are the greatest, are there any community needs that you have been able to identify but unable to provide resources for? And I'm trying to do this both at the same time, so bear with me here. Housing is okay. Housing is number one that most people are saying. Transportation. That's a big problem in Detroit. I can't speak for the other surrounding areas. Utility assistance, yep, that's one. Here in Detroit, I know that they will not shut off anybody's water as long as you pay the deposit. Water is still a crisis, yep, in the community, right? And utilities, internet, yeah, that's a big one. Since all of our children are now at home homeschooling, there's some people that don't have internet. Insurance, medical devices, food. Food is a big one. Okay. Great. Next one. What would make you feel safe about the progression of the COVID-19 pandemic? What would make you feel safely about the ability to return back to work if you're not working at home now? This is mostly geared towards the people who are working remotely. Do you feel safe about going back into the office with your coworkers? Do you have some anxiety around that? I know that some of us care for older parents, or someone may be having some medical conditions, so that's a big challenge for us. Make sure everyone wears a mask, yeah. I think this one would be truthful communication. I think that's coming from the company, I believe. I'm ready, I'm back and feel safe. Great for you. It would be nice to verbally hear some comments to questions. I can do lunch later, okay. We want to hear some voices here, so if you can chime in. I know we're kind of like doing a warp speed here, so if someone wants to say something, it would be nice to hear somebody else, because it feels like I'm in the woods and talking out to the forest. So.
Mr. Gray, it's so good to see you. This is Octavia from Inkster, Michigan, WWFHC.
My favorite person in the whole world, next to my daughter.
All righty then. Well, it's good to, and all these questions are so good and correct. We've actually been back in the office since April the 20th.
Great.
We were doing a lot of telehealth services, but now we're doing telehealth and in-person services. So we're here. I think we feel safe some days, and some days we feel like some people don't want to put their mask on, you know, something simple and plain, and take their temperatures, you know, but we're here. So we're hanging in there. Thanks.
Thank you. And please be safe and continue to work with our community. I think we want to applaud all the community health workers who continue to do their job in COVID-19 and still reach out to the community and go into homes, still touching other human beings, because that's what's missing, is that social piece with each other. So I appreciate you. Thank you.
This is Alfreda.
Hello, how are you?
I'm good. How are you? And I just want to make a comment. I know that with our organization, the Albion Healthcare Alliance here in Albion, we have been partnering with DHS and also our local college, Albion College, and we have a on-site free COVID testing site here in town, and that's been going really well so far. There are certain days that the community are able to go up and get tested, free testing, and there are certain days that the actual college staff and students come to get tested. So I think, you know, with that going on, and we've also been tested, that makes me feel a lot safer. We have been out of our office since the 19th of March and have been basically working remote for all this time.
Thank you once again for doing all the hard work and making a sacrifice from your family to still reach out to the community. I appreciate that. I'm sure all the people that in your community appreciate that also. Can you just keep me on track of time, Janae? I'm sorry. Go ahead.
Yeah. Let me just chime in and say, this is one of the ways that we're trying to make sure the voice of CHWs is heard, and that we're trying to do this breakout session, but we had a fail. But we will be distributing a brief CHW survey through our network that will really ask a ton of these questions. So we'll be able to ask you guys to provide direct feedback at these questions ongoing. This is not the last time we'll have these types of discussions. So I just wanted to encourage you that though we're jamming 5 questions into 15 minutes, we want to hear your voice. You can continue to share them via chat, and please do respond to that survey once we deploy it. And if you want to participate in the development of it, just let us know, and we'll make sure you get connected with our work groups. Well, Monty, we've just got, if we can do maybe just 3 more minutes, maybe one more voice to be heard from CHWs, we'll break and then come back at 12:30.
Yep. So if I can just close with a quote, and then someone else's voice can come in from the community, because I would like for them to close us rather than I. So one of my favorite quotes of all times is, "Not everything is faced can be changed, but nothing can be changed until it is faced." And that's James Baldwin. And I think that says it well. I mean, although, and I think one of our speakers said it, it is a big, large problem, and sometimes it does not look like we're making change, but to change the institutions, it doesn't happen overnight. It's a long stretch, and I think that's what Obama spoke to yesterday when he was speaking, is stay in the fight, continue to vote, keep your strength up, and just keep plugging away at it. So with that, I'm done. So if anybody else from the CHW world and my family wants to say anything in closing, I am dropping the mic.
Anybody feel moved to close us out? We got 2 minutes.
Are they going to force me to keep talking? So I guess I also wanted, I'm sorry. I just wanted to also say it is wonderful to see some males in this room with me, because usually I show up and it's by myself. Not saying that I do not love to be around caring women, but I love to see the men who show up and say that they're part of this whole circle. And I want to give an applause to MiCHWA's staff, who reached out to make sure that not only me, but these other males can be a part of it. And then we need to bring some other males in here too. So that's what I'll say. I picked the mic up and I'm gonna drop it again.
Mike Anderson, can you pick up the mic?
Yes, Gloria, I'm here. uh, I would just tell my brother Bomani to get used to it, you know, and we are making efforts to get more males to show up. But you know, I think that the CHW collective shows that we should be giving our sisters more of a chance and putting the reins more in their hands, because quite frankly, we as men have fallen short too much and brought the world and this particularly the continental United States to where it is now. So I'm always happy to be the only male in the room, so I can watch my sisters do what they do. And that's it. That's the
I
spirit
agree
of it.
with you too. Right on.
Thank you, everybody. So, you know, my next slide came up. It's lunch that we were supposed to reconvene at 12:30. Maybe take 5 minutes to grab something to snack on and come back, and we will launch again in 5 minutes to make sure we are staying true to our schedule. Thank you for your flexibility, for your responses. Keep the comments coming, and we'll see you in 4 minutes now. Okay, everybody, we've got about 1 minute. If you can hear my voice, just encourage you to come back, turn your videos on, and let's wrap up here strong. Thank you for your flexibility. Thank you for your patience.
Too. Yep. Now it's asking me for the meeting password.
Oh, make sure you mute, folks. Please make sure you stay muted. Going to get started here just shortly. Okay, everybody, it is my honor and pleasure to just recognize a number of CHWs that we are happy to invite to participate in our meeting on behalf of our previous president, Tressa Crosby, who is advancing her career in the Muskegon area, and also many board members and allies and stakeholders who donated and purchased a CHW scholarship donation ticket so that we can invite about 21 folks to join our annual meeting. So their names are listed here just briefly. Isaac, I'm not going to pronounce your last name or I'll butcher it. Danielle Hickson, Jennifer Reiner, Inger Blair, Tressa Krell, Vera Rowe, Carol Costa, Kalisa Reed, Terry Shane, Amy Gray, Gabrielle R., and Callie Sierra. So I just wanted to highlight each of these individuals as they took the time to complete our scholarship application. We were able to review them and we were able to share our meeting with all of these great folks. I think there may have been a number of other people who participated and received a scholarship, but we just wanted to thank you for your response. Thank you for working with us, and we'll have many of these opportunities as we continue to move forward and lift up CHWs. You know, we're getting to what I think is the best part of this meeting today. I'd like to introduce Jay Clement, who is going to award our 2020 CHW Recognition Award recipient. So Jay, please let me know that you're here. And we're going to go ahead and launch the opportunity to invite Miss Felicia as we award her for the CHW Recognition Award. And while Jay is probably trying to unmute herself, I'm going to ask you. Okay, sorry, Jay. But I think it might be helpful for folks to share a word that reminds you of Miss Felicia as Jay provides her this award.
Okay, so I will just start going while people are inserting their word. It is my extreme honor and pleasure to announce the 2020 MiCHWA's CHW Recognition Award. The award recognizes a community health worker who goes above and beyond the call of duty to serve their community. This year's recipient is someone I have gotten to know personally over the past 9 years. Anyone who knows her knows that she is someone who is selfless, who cares so deeply about her community. She cares so deeply, we sometimes have to remind herself to take care of herself. She's persistent. She is relentless. She is loving and kind. The way she described herself in the networking session was so true in the way that she just connects with people. She always greets me with a, hey, baby doll, and asks about how my children are doing. And she has so much flair. I feel like I can go on and on about Felicia Lane and all the ways that we admire her. We were able to put together this video, though, that I think will demonstrate better how her entire life and the commitments that she demonstrates to family values and her faith come through in the work that she does on a regular basis. So why don't we play the video and then we'll turn it over to Miss Lane, who I hope has her camera on.
Okay.
My name is Felicia. So they call me Granny Lane, and I am a community health worker for the WIN Network Detroit. I have been a community health worker for approximately about 27 years now. And I co-facilitate group prenatal care with a certified nurse midwife. I'm able, as a community health worker, to kind of tune in on the social determinants of what the moms might need. My part is to help kind of have a foundation. Well, how can I help you? What's going on? What you might need to kind of like bring that baby into a healthy environment.
When my son was 8 days old, we were in a house fire. We pretty much lost everything. That was a devastating time for me because I didn't know how we would get through that. But thanks to Miss Lang, WIN organization, and Courtney and everyone else, you guys helped me tremendously.
And that's what community health workers making a difference in the lives of the people that we touch.
Absolutely.
You know, everybody can't be a community health worker. You know, that alone is your uniqueness in itself. It hits us to the core of our hearts. It's like a mission. It's not just a job or a title. And we help people recognize that you already have it already inside of you to pick yourself back up, to get back up, to make your life better, to make your health better, to make your family better, and in ultimate, to make your community better. And it was always in you. And you just had somebody like us to just give you a little extra hand.
Felicia, Dr. Kimberly Dawn Wisdom here. I want to congratulate you on being the recipient of the 2020 MiCHWA Recognition Award. It is so well deserved, and we're so very proud of you. Keep up with the fantastic work.
Miss Lane, on behalf of everyone at Henry Ford and WIN Network, I salute you. You deserve this.
Felicia Lane, congratulations on this honor, and thank you so much for your service. You are a supreme community health worker and more than deserving of this award. Congratulations.
Congratulations, Felicia. You are so deserving of this award. You represent community health workers. You're the ultimate community health worker, and you deserve everything that you get. I'm so proud of you, so proud to be your co-worker, so proud to speak and see in this journey with you. You're such a phenomenal woman. Congratulations.
I just wanted to take the time to congratulate you on winning this award today. If anybody that deserves this award, it is you, Felicia. Keep doing the awesome work that you do. Keep working with the families the way you work with them. And thank you for all you've done for my family. Take care. Continue to be blessed. Love you.
Hi, Felicia. You deserve this award so much. We're so proud of you. It's amazing how much you give of yourself to the people that you love, and you're amazing.
Congratulations, Felicia. You are such an amazing person. I enjoy working with you. You have been such a helpful and loving person in my life over the last few years. And you are so deserving of everything great that comes your way. Congratulations.
It has been an honor to serve alongside Felicia on the Michigan Community Health Worker Alliance Board of Directors. Felicia is an inspiration. She's an advocate. She is a leader. Thank you, Felicia, for your dedication to MiCHWA and the Community Health Worker Network.
It's such a pleasure to be able to congratulate you, Felicia, for all the great work that you do for MiCHWA, for your profession, and for the people that you serve.
Congratulations on this well-deserved award. I am so proud of you. You have led the way in our community with your loving and devoted heart. Congratulations. I love you.
Congratulations, Mama, on being recognized today. There is no one more deserving. Thank you for showing me the positive impact one woman can have on her community. I love you.
So let's please give Miss Lane a round of applause. I was watching her on the camera the whole time. The way her face lit up when her daughters came on was just, it was touching. On behalf of the MiCHWA Board of Directors, the staff, and volunteers. Felicia, we salute you, and we want you to please bless us with any reflection or reaction that you have.
Oh, wow.
Now.
I don't know if y'all can see me or hear me, but I tell you, oh, wow. I am
We
just.
love you. We love you. We love you.
We love you, Felicia.
Love you. Love you. Love you.
We love you, my sister.
Love you, Miss
Mama,
Felicia.
mama.
Love you,
Felicia.
Love
Love you,
you.
Felicia.
Love you.
Love is all over
Congratulations.
there for you, Felicia.
Congratulations. Keep up the great work, my
Love
love.
you.
My queen.
I tell you, I am
Congratulations.
truly, truly touched. I mean, it's just so beautiful just to have somebody just to even think of you and everything. I just wanted just to start to say this from a quote, and you probably know. As two famous people in my life, George Washington Carver and Henry Ford and everything. But George Washington Carver said, no individual has any right to come into this world and go out of it without leaving him or her a distant and legitimate reason for having passed through it. I just want to say thank you for me having a purpose. That's what it's about, having a purpose in life. And I don't do this to get any award or anything. God has blessed me because I love people, and I don't care who you are, where you come from. I see people for who they are, and it's just a blessing to even get anything, a piece of paper, a piece of candy, a little teddy bear. Jay, she leaves a little teddy bear when you do good work and stuff. And you're like, well, oh, really? What did I do? Oh, I didn't know that. But I like the little teddy bear. It's just nice to know that that's what we all about. We all about leaving a legacy. George Washington Carver, I like him. And, he left a legacy. And you know what he said? He said, put our American can be greater and great. Put our distance aside and just look at the long term legacy. And what legacy did he leave? I mean, we all use flour, and he's an inventor of flour, 300 things that we use. What a beautiful legacy. And Henry Ford, when I met his grandson, he knew I loved his grandfather. I never knew him. But I mean, I cannot imagine driving. I cannot imagine not having a car. And so see the legacy that Henry Ford left. And they were two friends. They didn't see color. They saw what can we leave as a legacy, not only to our family, because when you think of Henry Ford is Michigan, okay? But I mean, a legacy to people. That's what our children, our families, and that's what we got to believe in. We are a great nation. And one thing that's going to happen the day after the election, somebody is going to lose. But what's going to make us great is that we stand together no matter who wins. And we stand together to be a better community, a healthy community, and to be a better nation. Because as Americans, we are. I remember my dad went to Saudi Arabia, and he came back and he kissed the ground when he got off the plane. My father said, this country is the best country ever. And we can make it great. We can make it great. We can make it better if we just all stand together as one. And you allow me to have a purpose in life. And I thank you, each and every one of you. May God bless you to have a spot in paradise for all the work that you do. Thank you very much.
So, Miss Felicia, I just want to encourage you to see all the love that these 200
Miss Felicia.
have for you by looking in the chat. And then I want to show you, this is on its way to you.
Oh, that's so beautiful. So beautiful. And I share it with each and every one of you, people that I haven't met, people that I only met virtually. I'm going to carry a piece of you. Your life is like a train. You pick up people and passengers, and then passengers get off. But each and every one of you, I'm going to take a little bit of each and every one of you to my final destination. May God bless each and every one of you. And my dad used to always say, may all your dreams come true. Thank you very, very much. Thank you. It is truly a surprise. At least she had hit me yesterday and I was like, oh my God, really? And you know, I never really kind of thought about getting anything about any time, but I just say thank you. I love what I do and I love y'all. And y'all doing a good job. And just remember, you are making a difference. You know, I'm gonna just say this last thing. You know, I walk the walk, but I can talk the talk, because a community health worker came into my life at a time when I really needed somebody to come into my life. And she told me things will get better and I contribute and that was my son is 29 years old. That was 29 years ago. I still remember that community health worker. She had changed my life. And remember, you are making a difference in people's lives. Don't ever think that you're not. They might not say anything, but one day they might come back and let you know that if it wasn't for you, I would not be here where I'm at today. And that's just what I say to us as community health workers. Keep doing what you're doing. And we're getting our accolades. It's coming. And everybody, just remember, you at the right place at the right time. Thank you very, very much. Thank you. I need a box of tissue, y'all.
And I just want to thank Harry Ford, Allie Rooker for putting together this video. Beautiful, it was perfect. Love that it ended with her kids.
And my children didn't even say anything. And that's something. Oh, beautiful. And that's something. Oh, you're so kind. Thank you very much. I treasure each and every one of you. Keep up the good work. And may God bless you. And like I say, may God have a spot in paradise for each and every one of you.
So, Janae, do you want me to just keep going?
Yeah, but I don't want to be the last person to speak. I want them to hear you last. So let me just do a little final updates and remarks. Just thank you for your flexibility. We will be sending out automatically, I think at about 2 o'clock, a survey for you to provide feedback and let us know if you want continuing education credits. So please respond, give us 5 days, business days to deliver your CEU certificates back to you. And I just want to say thank you. We will share all of the slides. We apologize for the technical difficulties, but I'm happy to introduce again, Jay, our fearless future president for 21, to close up our meeting.
Okay, thank you, Janae. You have put so much pressure on the board to actually vote for me next month. I'm not officially anything yet, but it has been my great pleasure and honor to spend this year learning more as vice chair. And I'm standing between my own self and lunch at this time. I want to try to close us out. Someone put in the chat earlier, when life gives you lemons, make a Long Island iced tea. I'm gonna make that my new mantra in life, because that was way more exciting than lemonade. And I think we've learned more about being flexible and adaptable, which is a phrase I learned from Mike Anderson earlier this year, before COVID hit, about the power of CHWs to always stay flexible and adaptable. And I think that's been on display today. So I originally wanted to do reflections on what I heard today, and I'm gonna try my best to still do that. I thought I would have lunch to type it all out and organize my thoughts, so it might feel like it's a little all over the place as I go through this. I'm gonna try my best. I do feel so full of emotions that I had not anticipated feeling before. I think this virtual format ended up working out better for us than we could have ever imagined. For one, we all got to experience all of the breakouts. And two, I think the emotion of Miss Lane getting that recognition would have just brought the house down if we were in person, because I could see people in the gallery wiping tears or beaming with pride. So I think today has just been one where we've been able to get filled up in a way. CHWs give so much of themselves, and we're always talking about the importance of self-care for our community health workers, because as they're pouring out, we want to make sure they pour back into themselves, or that the people around them are able to pour into them. So I hope that everyone feels that fullness today. The word love came up multiple times throughout the day, love and friendship and hope. So I feel full of hope, full of vision, full of new direction, full of inspiration and motivation, full of information. We had a lot to take in today. And before I start doing those reflections, I do want to take a moment to thank the planning committee for this meeting today, and especially to honor our executive director, Janae Tyus. So I invite people to come off mute for one more second and just applaud.
Yes,
Or
Janae.
thank you.
Great job.
Yes,
Wonderful.
excellent.
Excellent.
Very good, very good.
Yes. Yes.
So I know I speak on behalf of our entire board of directors, your colleagues, and the community health worker network across the state when we say how very proud we feel today. Proud of this organization, proud of the work that you do, Janae, and proud of the team that you are leading. I cannot even think of where we would be right now without your tenacity and thorough attention to detail. You have helped guide MiCHWA through a very transitional year, and we know that great things are ahead of us under your leadership and your advocacy and your hard work. I also want to make sure that we thoroughly thank the team that you've been building with Jen Hurst, Portia Fisher, Nicole Host, and Nia Watkins. All of your hard work, we can see it in the way that MiCHWA is being run on a day-to-day basis in the daily operations, but absolutely manifested in this conference today. So just in reflection on, look at my little chicken scratch notes and lots of notes. So I will not go through all of this, but some of the great takeaways that we heard today, even from Janae reminding us of the importance of the organization within MiCHWA and using that registry, becoming members, and really aligning all of these stakeholders so that we can keep moving the needle. I encourage everyone to check out the MiCHWA.org website, to follow all of the social media channels, join a work group. Let's request that supervisor training at all levels. I know we can use it more within Henry Ford and across a variety of organizations, and do what we can to lift up the voice of community health workers in all of the work that we do. Our keynote speaker, Ashley was a rock star. First of all, let's just put the shining light on the difference that she's making in Philadelphia, and obviously on this national stage when she's able to share her stories and the stories of the people that she worked with. But hearing Dr. Kangovy talk about this pandemic of injustice that we live through every day, pre-COVID, during COVID, and hopefully not for too much longer, but that's the work that we've been called to do. So, let's continue to co-design our work together and magnify the power and the impact that we know CHWs are having on a regular basis in ways to continue to drive change. When we pivoted in the breakout sessions and demonstrated our flexibility, we heard so much from all of the speakers. I'm afraid to try to summarize it all. But so I'll just thank our speakers and all of the highlights that we heard about putting love into our work, into making connections, putting community health workers in the driver's seat, and sharing spaces of power and advocacy and applying the full spectrum of their strengths, not trying to, create a box and check off regulations, but really, how do we draw out the strengths and the powers that we have inside of the community health worker workforce. So let's see, how are we doing? 6 minutes and my stomach is rumbling. Myself, I try to be good and not eat on camera. So I look forward myself to being able to continue in this service leadership role that I've been called to with MiCHWA over the next 2 years. And in this capacity, and over the next 2 years and beyond, I should say, because I know that serving a term in leadership won't be the end for being connected to community health workers, because I too have been being impacted for as long as I can remember. I was actually an intern for Edie Kiefer when I learned about community health workers in the very, very early 2000s, maybe 2002, 2003, and got to learn from some community health workers teaching me what to do and how to do it beyond what we were learning in our classrooms. So my hope for MiCHWA in the next couple of years is really to see continued growth and see how we can work together with community health workers leading the way to grow our membership and to grow the leadership of community health workers as a state advocacy group, but also within each of the organizations where community health workers sit. We want to see opportunities for CHWs to grow as a career field. And then of course to grow the financial sustainability and policies that will undergird all of that work, so there's long-term sustainability for community health workers. In the meantime, I would be remiss if I didn't echo what Ms. Lane said about the power of your vote. I know thousands of people have already voted across our state and across our country, but I hope that all of you, if you haven't voted already, that you get out and vote, that you make a plan for voting. There are ballot boxes, there are drop-off centers, you can vote in person, you can vote at your city or your county clerk's office. So I won't get partisan with you because MiCHWA is a nonprofit now, its own 501c3, and we're going to respect and honor and protect that, but let's all remember to vote. So on that note, I thank you all for coming. I thank the board of directors. I thank the MiCHWA staff. And I thank the community health workers that give us purpose and are ushering in a paradigm shift to improve healthy communities for everyone across the state and across our country. So thank you.
Right on.
Thank you.